It's really nice. Several buildings. Okay. Yeah, it'll be.
Yeah.
That's right.
It should be 17 inches, just great. Down. It's
Cool. Yeah. Right. Did you look here? Sure. Yeah, you're pretty far from having huge.
I would have thought it's like I know that we should last a little bit longer.
He does have more land. It's in the county, so you can park it. Yeah. Yeah. That's two.
Would you look at that Sunfish that was in the paper?
No,
No.
the one I.
Okay. Super easy. Like,
Yes. Or you're.
oh yeah. It looks real clean.
It doesn't dance the shape.
I can only
pretty much count
It's just.
That's key.
So,
Yeah. It's the original. So if you know of anyone.
place to park a boat.
Okay.
Zach might have room.
Let's go back. Summer, really? They have, I guess, one little dirt pot over there that is available in the summer.
Yeah.
We to go to the
Row Club.
It's like a little, I want to buy this little runabout, like a classic runabout. Yeah, I like a little younger boat. Not like, pretty simple.
Oh, right. Continuous.
Oh. You also want that. Continuously transfer to office, subject to the permitted exceptions approved by Chaplain. It's just put it dead, but you don't want it to start. Yeah, I think that's good. That's right. Let me give you some language by those business.
Wait, sorry, what did I do?
No, it's just because of your luckiness. Your tenant is looking from sales.
Thank you. Why don't you just go and start?
Perfect, thank you.
I just looked at your water.
Great. Dan will be 30 minutes or so late. He's watching the kids. And with that, let's call to order the work session of the Frisco Town Council for April 8th. And with that, we'll roll right into our first session. Thanks everybody for being prompt for pictures. We got through it really quick. And with that, this is going to be our nonprofit overview. And then we're going to be started off with Diane, right? And then we're going to roll into multiple different nonprofits. So present with that.
Great. Thank you, Mr. Mayor. Mr. Mayor Pro Tem and Council, thanks for having us here today. Very excited for all these presentations that you're about to see today. We hear from 4 nonprofits today, starting here with Building Hope and in Kellen, who will be taking it away here in just a moment. And just as a reminder to the council, you saw in your council packet and the staff memo, I think you all understand and know the importance of all these nonprofits within our community. as a whole, right? As the county, as well as their contributions to Frisco. They mean a lot to us. We're very fortunate to have each and every one of them in our community. We'll hear a lot today in terms of what they do, the details of what they do, the programs and the services that they provide. And we really want it to also be an engaging conversation today. So if at any point in time you have questions, you want to ask more details, please feel free to do so. Each of the presenters today will have a PowerPoint that they will go through. But also as questions come up or you have anything that you are interested in, please do ask the questions. As a reminder, the town of Frisco does contribute financially to each of these different nonprofits that are going to be presenting today. And that number, as you saw in your council packet, is right about that $676,000 annually that is contributed to across the board to these 4 nonprofits. Of course, some are a little bit more than others, pending the programs and services that are offered. So if you don't have any questions, I will turn it over to Kellen and have her take it away.
Great. Thank you all for being here. Thanks for the intro. I am here to present a little bit about Building Hope, as well as some of our overall system efforts that we have done and made improvements on in the last several years as a whole system for mental health care for the community. So one of the roles that Building Hope plays, in addition to some of our direct programming, is to have this kind of pulse on our entire mental health system for the community. And so that's something that I want to talk with you guys today about, not just Building Hope, but our whole existence in the community. And so we're going to go through some of the trends from the data. The county, Building Hope, and hired an outside consultant named Dr. Nancy Van to do a mental health improvement plan for 2024. We've done these a few different times in the community between 2018, 2019, 2022, and then updated it in 2024 this year. It really just gives us an idea of kind of where we've come from, the building blocks that we need to continue working forward to fill all the gaps within the community. So I'm going to go through some of that data, the system, the improvements that have been made. I'll share a little bit about the exciting work and the improvements and impact that Building Hope specifically has, and then our next steps in the community. And I apologize if I talk really fast, but I do know that I want to give time for questions. And as Diane mentioned, if there's anything that comes up along the way, please just stop me. So what the data says, and I have a hard time starting with this data point, but it says that adult mental health appears to have worsened in Summit County. And I want to just say with that caveat that a lot of times when we talk about mental health symptoms showing an increase in negativity, we also talk about that as a positive, because a lot of times that's a result of people getting help and accessing it and realizing that they have a problem. So Summit County, Building Hope, we've worked really hard to reduce stigma around mental health treatment and access. And so we've promoted people to admit when they have a problem and admit when they struggle. And that is one of the results that we see, is that people do report that I'm not doing great overall at a higher rate. And so we do see that this looks to have worsened, and that might be because we're having a community that's supportive of people reaching out for help and being able to access it when they do. We also see that these data points that we have looked at were, most recent was 2021. And I just, you recall 2021 as a tough time in people's lives. So that was also what we are looking at now, is improving that data so it's more relevant to 2024. And we do see that some of the trends that we're noticing in terms of our community surveying and where people are at, is that number is improving as far as people reporting the mental health days as poor. They are getting better and seeing that improvement. So I'll just start with that one and say it's not as bad as it looks on paper. Number 2, excessive use of alcohol remains a significant issue. This is something that is no shock or surprise to anyone in Summit County. Alcohol has always been one of our problematic behaviors here in Summit, and it continues to be something that we're struggling with. So people report a higher use, higher binge rate, and struggling with that. And we know in the mental health field that mental health and substance use are very closely linked. And when you have struggling with alcohol, it might be a result of a mental health issue or vice versa, and you're using it to cope. And so that's something that we're really looking at these days, and trying to help support folks who maybe want to have more of a moderate relationship with alcohol. Building Hope and various community partners have worked together to put a Booze Less Summit campaign together. And so we're partnering with a lot of different resources, entities, agencies, as well as bars and restaurants to promote this campaign and this sort of moderate level drinking, and just an awareness piece around, you don't necessarily have to binge drink. You don't have to have all alcohol all the time. And every event doesn't need to be surrounded by drinking and heavy drinking. So we're just trying to promote that as an option, drink a little less, booze a little less, do more, do a lot more. And so that's kind of the tagline. We're trying to share that out in the community. We also have lots of different options for folks to drink more water at different events, and we're partnering with the towns in Summit County to have water available at more of the events, and have a booze less kind of banner and notice and water cooler at those events, just to kind of promote that mindfulness around drinking behavior. Mental health among middle and high school students does seem to be improving, which is a really great statistic. We've been working really hard as a community in the last several years to improve our young adolescent age group and improve their mental health. And so we are seeing that those data points are actually demonstrating that the improvements are being made, and kids are feeling more supported, they're feeling more protected, they're feeling less like they have no options for mental health care when they need it. So that is really great. We're seeing less of a significant change in the middle school age, but we are seeing that shift being made at the high school level for sure. Alcohol use for high school students also appears to be declining, which is a great statistic and a great show. We are looking into further to see if there's shifts in maybe what they're choosing as the drug of choice, or if they're changing their alcohol use into something different. We haven't dug into that specific data. We are doing that currently, but it is positive to see that at least alcohol use, as it's reported for high school students, is declining. And then access to behavioral health services has definitely improved along the years. And we've done a lot. Building Hope and the community have done a lot to improve that access. We've brought in new providers, which I'll talk about in the next couple of slides. We've really helped to improve and to expand our network that's accepting the Building Hope Scholarship. We've partnered with Eagle Valley and Vail Health, Behavioral Health, and Mountain Strong, and that has expanded, almost doubled our provider network. We've also worked hard with the Front Range and Fort Collins area to make sure that we have providers that are able to see people. We are still in a need area for some of our in-person Spanish-speaking residents. So we have capability to have folks who are seen in their native language of Spanish, but they are oftentimes not being able to see them in person because we have to do those sessions telehealth or outside the county. So we're still looking at some gaps. We also have folks who, if you're looking for a specific therapist or specialty care or outside of workday appointments, those appointments are more rare and get filled up really quickly. And so we do see that people still have wait times when they're looking for that specific need. But if you wanted to see a therapist and you didn't necessarily have a specialty or a date and time range that you needed to be flexible with, you can get access, which is not usually and hasn't been the case in the past. So we're really happy to see that improvement. Program development, so strong future funding, which you guys as a town contribute to as well. You have prevention, intervention, treatment, and crisis services that are all supported by this funding. And this is the continuum of care, we call it, in the mental health field. So you start with prevention and you go all the way into treatment, and crisis services are sort of on that back end, front end of the service stream. So we've seen a large impact and a large, lots of gaps being filled within these programs. And I talked about kind of where we've done to expand treatment. Treatment is obviously the biggest level and the most amount of funding that we've put towards for that access. And that is because when we started this work and we started building a system, we really just needed to get people help right away. And that treatment level was the greatest area of need and the greatest area of impact. Now we are starting to expand into creating more prevention level services and more of that side of things that maybe has a little bit of a further downstream effect. But we are still very motivated and very in need of continuing these programs so that we don't end up having gaps that are there again because we end funding or stop putting the energy towards them. And I don't necessarily need to go through all of them. As you can see, there's lots and lots, but if you have any specific questions about any of the programs that are listed, I'm happy to answer any of those too.
What's gonna happen to the SMART program?
Meaning?
It's in the crisis. Is that like if you're in crisis, or I thought you meant programs that were?
So, I mean, as far what's going to happen to it, I don't know what that question means.
Never mind, I didn't get it.
Does it in the box that it's in mean that it's?
Oh,
Okay,
treatment.
Okay.
So crisis services, that's when a person is in crisis. If they need immediate help, they need immediate response. That's where those services come about. So the SMART program within the sheriff's office is obviously that co-responder side, and they are able to attend and support any person who is in crisis in the moment. And then they are also supported within the Paragon Behavioral Health Connections, and that program is a little bit different. So it's mobile crisis. They have co-response available when needed, but not with a law enforcement technician. So SMART is with law enforcement and a clinician, and it's always a paired response. And then the Paragon is mobile crisis, where it is a clinical response, and then that might be combined with an EMT or paramedic or firefighter type of support staff. And those programs work kind of in conjunction with one another. SMART is if somebody is in immediate danger, they've ingested something, they're going to harm themselves, they need access and need emergency support. That's who SMART needs to be involved. Paragon doesn't respond to those calls necessarily, but they are there to help if somebody is feeling suicidal, but maybe doesn't have the means or the action orientation. And Paragon also has more of the wraparound services. So they're able to provide kind of that stabilization therapy and counseling every single day for up to 2 weeks. And you'll see Building Hope immediate access slots were previously on that crisis services. We ended that program because Paragon came into the community and offered those crisis stabilization program. And that's a much better way to wrap around services within an agency. The Building Hope program was sort of a hodgepodge of private practice therapists. And so it was a little bit more coordination and a lot more staggered versus Paragon being an agency and being able to support that as a whole. And so that's where that's at. And
Elizabeth, it's a good question because you've read in the paper, the sheriff has put an op-ed in the paper recently. There's been previous articles about the county's budget and how the sheriff's office budget is such a large portion of the county's budget that there are services that the sheriff provides that could be affected by that in the future.
Yeah, sorry. And then when I saw Sunset June, I was like, oh, this is the stuff that, anyway.
That's maybe going away. So I can't speak to what's happening at that directly. What I can say is that it has been a very impactful program in Summit County, and it's still a program that I hope to see continue in Summit, as well as the Paragon Behavioral Health Connections response. So separate, same but different in terms of their response, and just increasing the collaboration and increasing the amount of resources that we have for our community is really what makes me happiest and what I see as being most beneficial.
I have a question. Do you know what the utilization looks like for Paragon, like responding to crisis?
as far as like time that it takes them
Like-
to respond, or
like
how much
how-
they're actually
Like
responding?
out of all of the crisis responses in the county, what percentage of them are from Paragon,
I think
roughly?
smaller, much smaller. I don't know the exact percentage. But what I would say is that our community in particular, and a sort of a natural response and a natural indication is when you have a crisis, you call 911. And when somebody does that, they get the SMART team response. And the SMART team will go and access, and the local PDs have access to them issuing SMART and bringing SMART in. And so Paragon is a response that isn't accessed quite as often because of that. And they get their calls are coming from 988, Colorado Crisis Services, the state hotline, or through their direct community number. And what I will say is also that the SMART program has been around longer. It has more of a presence in the community. It has trust and support within the community. And so there has been kind of a lesser use, I would say, of Paragon. I would also say that when somebody's in crisis, typically they need they're in an emergency. And so 911 and SMART team is typically the first responder. I would say that Paragon's real improvement to our system in particular is that crisis follow-up, that stabilization program, and being able to offer the aftercare that we have been lacking in Summit County for a long time. So I don't know the exact percentage, but I could get it for you.
I'm just curious, because
Yeah.
I know that, most people call 911.
Yeah.
I think we got 2 988 calls when I worked for the SMART team for the
Yeah.
whole year.
Yeah, it's
Before
definitely a
Paragon was
lot.
around, so.
Any other questions on programs in particular? Some of the ones that were kind of bigger improvements in the last couple of years were Mile High Behavioral Health Care. That came in the last couple of years. They provide currently an adolescent enhanced outpatient program that is shifting into kind of an all access adolescent. And that's Robin's still working over there, so that's great. But they have more treatment and more offerings available for adolescents in our community, which obviously has been a huge need. And then the Wellness Hub coupled with Torchlight Health, or previously Front Range Clinic, to do medication assisted treatment. And they also now do psychiatric medication management as well. So that's been a super helpful support. And they can also partner with Recovery Resources, which is our withdrawal management or detox, to help support if folks are needing medical attention or medical support to relieve some of the symptoms of a detox, which we don't have. Medical detox and social detox are different. There's a lot to go into there. We don't have time for today, but those are kind of the programs that are available here. And so we have filled a lot of gaps in the community. These are gaps that were identified in the last couple of years as being needs. And so we have worked to bring these entities into the community and partner with these entities to fill those gaps as far as the category is concerned. So mobile crisis response, peer support, mental health and substance use were priority areas for the last couple of years. And those are how we're filling them at this point. Building hope in the community. So as I mentioned, Building Hope's role in the community is a little bit more nuanced and a little bit more background work in terms of capacity building. So we have direct programming in terms of, well, it's not even direct programming, but we have programs that we manage under our own house as far as our scholarships and connectedness events and such that I'll go into. But some of the work that we do is a lot behind the scenes. So we look at the providing that systems capacity building, that overall connecting, engagement, kind of supporting the whole community. So we really make sure that when we do have a new provider that comes into the community, or when we need a new provider, we're helping kind of situate and organize them and connect them to the right people and the right organizations and make sure that there's a lot of collaboration happening. And so we're sort of doing the mixed level work. And we also work really hard at making sure that our provider community, so our behavioral health provider community, is really well supported in Summit County. So we've done a lot to improve that networking and that feeling of you're a part of a bigger picture here. You're not just working on your own. We have a lot of private practice therapists, and I was one of them back in the day, and there was a handful of us that went to our office and never spoke, and that's how we did business, right? And so now it's a very connected community where there's mixers, there's networking, there's meetings, there's a lot of bringing people in together to support one another, and that really just helps your clients and the community at large. So in addition to that, we also do a lot of mental health trainings for the community and make sure that we have a community that is well versed in mental health language. So some of our program specific work that's been done, our mental health scholarship program has given 581 different scholarships in 2024, over 5,000 sessions. And we've also been working really hard to help navigate people to working with their insurance. So we've also done a lot of work on the back end or the prevention side around building a community of providers that accepts insurance and that accepts the right insurance and can bill the insurance properly. So we work with an outside third-party biller and credentialing to help our providers get credentialed and be able to bill successfully. And then we also help when a client calls, we make sure that they understand their benefits. And if they can utilize their benefits, we try to get them into somebody who can see them using their benefits, which is obviously something that we all want to be able to use when we're paying for our health insurance. We want to use it. And it also helps with parity for mental health and physical health, which we're happy to see as well. So we've seen that a lot of people that we talk to, we're able to get them into either Medicaid or an insurance provider that can see them. We also do a lot of professional development and peer support. So we help with licensing, supervision. So when you become a therapist, there's a lot of professional development, continuing education you need to do, which gets very expensive. So we provide mini grants to those providers to be able to do those things. And that also enhances our capacity here in Summit County. It enhances the level of support that a client is able to get in Summit. Our community connectedness events and hype events are really a way to just engage our community, sort of describe them as soft mental health, and they're a way for people to be able to connect, to reduce isolation, and really just be together in the community. Those are always free. And then the hype events are specific to youth for 12 to 18-year-olds. And we started those in 2021 as a result of the 2 youth suicides that happened in that year. And then we have training sessions, of course, in Spanish and English. And then recently in 2024, we also created a Building Hope resource guide, or community resource guide, I should say. And it highlights all of the different mental health resources that are available by category. So by crisis, by youth services, by intervention level, all of the different continuum. And we're really circulating that around the community. So I know our staff member, Sabrina, is going through our long list of people and folks in town of Frisco. We want to have one here, and then at the all of the rec centers in the area and any other community buildings that we think would be helpful, as well as having it online and resources, just making sure that those are available to the community members when you need it. So what's needed and what's next? So these are kind of the identified areas of priority for the coming couple of years. So we realize and understand, as you mentioned, there is additional need for that coordination of the crisis services. So now that we have a couple of different entities providing crisis level behavioral health services, we need that additional collaborative service between the hospital, between recovery resources, between Vail Health Behavioral Health, which provides our mental health treatment center, as well as SMART and Paragon. So everybody coming together, we do a monthly meeting with those entities to really talk about kind of what our procedures are, what the protocols are, how as a community we attack crisis and the response, so that it's not a situation that a person is confused by, to the best of their ability. We also see that we have a need for expansion of services for children, and that's that younger folks and families for that enhanced collaboration again. So right now at Youth and Family Services and Summit County Public Health, there is a collaborative management program that's being run and bringing those entities together. So if a person or a family or a individual is in need of multiple different agencies of support within Summit County, that collaborative management program really brings those entities together to work for the family, rather than having the family have to go and sit down at 7 different meetings. They can sit at one and have everybody work together. So we're bringing more of that collaborative stuff together into Summit County, and we're also looking to really hone in on the children's specific services. We've done a lot of work, as I mentioned, on that adolescent spectrum and the age group, the middle school, high school age. Now we're seeing a need for more attention at that prevention, younger childhood level. And then continued support for our small provider community and doing all of the work that we do to support those folks and keep them able to have thriving businesses in Summit County, as well as being able to support our community really well. And then targeting that Strong Future funding to address these county priorities. So as they come, the Strong Future funding will really be prioritized around making sure that the gaps are being filled and making sure that these are the programs that really need the funding will continue to get it. And I think that just leads me to my thank you. So I really appreciate being here. I've been going on quite a road show in the last couple of months. So I'm just happy to talk about mental health and all of the work that's being done in the community. And thank you guys all for your support. As I mentioned, the town has really put forth a great effort with supporting our nonprofits, and we couldn't do this work without you guys. So I appreciate it.
And the Soul Center is finishing up.
The Soul Center is finishing up. Yeah, it sure is. So we're very excited about that. And we're super happy to have that kind of Building Hope and FERC coming together again. We service a lot of the same clients, a lot of the same families, and it'll be a really, really exciting kind of one-stop shop for folks.
Can you tell us a little bit more about the Soul Center?
Sure.
We've got a few new council members on board here as well, and
Yeah.
may not know much about it.
Yeah. So the Soul Center is a new building that Building Hope and FERC are building in Breckenridge, and just outside that first roundabout by the BDC. And it is going to house all of FERC's services, so the thrift store, food market, and their offices for their staff. And then Building Hope will also have offices for our staff there as well. So we're bringing together those organizations. We're still going to be separate organizations and work separately, but there's a lot of opportunity for us to collaborate. And within the same building again, and I keep saying again because Building Hope was born under FERC and within FERC's walls. So we're kind of always been working together and always been super supportive of one another's energy. And so it is going to be very beneficial for a community member to be able to walk in that one building and get all of those services from FERC, and then also be able to get that mental health aspect as well, because we do see such an overlap. Because if you have food insecurity, if you're looking for housing and health insurance support, if you're really struggling, a lot of times that has an effect on your mental health, or you're struggling with those things maybe because your mental health is at risk as well. So we're very excited to have that, and we have finished the funding campaign, and this is a huge partnership with BGV as well. And so we're just very happy with the town of Breck and all of the municipalities that have done work to bring that project together. It's really been an entire community process and project. So excited to have that.
Does Building Hope collaborate with Treetop?
Yep. Yeah, so we definitely work with Treetop a lot, and one of our mental health trainer is also one of their forensic interviewers, and we definitely try to help support one another. They refer to our scholarship program and work with our care team to make sure that if a family member is in need of mental health services, we get them a scholarship and help support getting them into long-term therapy. So, cool. Yeah. Any other thoughts or questions?
Thanks for.
Always a
Yeah,
good-
thank you.
Yeah, thank you guys for having me. Thank you. See you later. Thanks.
Yeah, we're getting there right now. Yeah, thank you so much. Yeah. Yeah, happy.
Hi, how are you?
So good, thank you.
We could just control it either with the zero fees or with us, whatever
I
you.
don't, I know, you've got it all. Do you know everyone's sitting at the table as well?
No, some, yeah.
Cool. Hi, do you want to intro?
Just, yeah, my name is Rick. We'll start off with some intros.
Okay.
With that,
Rick, hi.
And,
Tom, hi, Tom. Well, thanks for having me. I'm Catherine Schaff, Executive Director of Early Childhood Options. We are, Summit County Child Care Resource and Referral. So anything and everything for children ages 0 to 5 in Summit County. I just kind of put together this quick agenda. I assume it would be in your packets that you receive, just of my slides today, mainly talking about childcare tuition assistance, which you all contribute to for our community as a whole and infrastructure of childcare.
Catherine, we've also told the council as well that we want the conversation also to be as engaging as they want it to be. So if they have questions throughout the presentation, to feel free to ask you questions and things, just to keep everything kind of moving along.
Great.
Thank you.
And just a little overview of kind of our mission statement: improving the quality, availability, and affordability of early childhood education in Summit County. We are a subrecipient of Head Start program, Head Start being a federal funded program. Summit County government is the grantee, and then we provide the program services and support. We contract out those slots for the children ages 0 to 5 with partner programs. Those partner programs being Summit School District, Summit County Preschool, Lakeville Preschool, Wildflower Nature School, and Carriage House. In total, we have 60 slots for that age range. 25 are early Head Start, so that's your 0 to 3 age range, and then 35 Head Start 3 to 4 year olds. Summit County Preschool in Frisco holds the most of our community childcare slots. Those are 15 Head Start slots. In order to qualify for Head Start, you must meet income guidelines of 100% of FPL. 100% of FPL is under $30,000 a year for income. So quite drastic, and if you really kind of wrap your head around what that means for a family, it's kind of jarring for you. For Summit, for sure. And then we also do quality initiatives, and that's our high quality environment in our childcare centers that include coaching, resources to materials, observations for their environment, mental health support services to the children, to the teachers, and to the administration in those buildings. And then our largest arm, I would say, is our tuition assistance. We have the two main programs that are both county and municipality funded, First Steps and then SBK. First Step, all the municipalities contribute to based on data of live and work. And those service the 0 to 3 ages, and then Summit Pre-K program, 3 to 4 age range, and funded by the Strong Future funding from Summit County government. ECO has 13 full-time employees. I kind of put some little data points that I think are really important to understand about early childhood investment. Per the Heckman equation, for every dollar that you invest in early childhood has an ROI, return on investment, of $17. So there's no, I think, higher investment on your dollar than there is for early childhood. And so that's why we really value the importance, and I think the community values the importance of high quality early childhood education. And then my other fun fact that I get from the first 5 years fund, about 80% of brain development occurs within the child's first 3 years of their life. Incredible, right? They're what little sponges. If any of you have young children or have raised young children, you might kind of recall any of that. Any questions about ECO?
So the state of Colorado, with their funding, they've decided to cut earlier intervention. And do you guys have any plans to provide any early intervention for 0 to 3 for kids that have disabilities?
We're kind of a side arm of that. We really work towards screening tools to refer on to developmental intervention services. We provide in our quality initiatives, we do a menu of quality services for all of our teachers and offer those trainings yearly, and oftentimes have those therapists from early intervention come in and help train the teachers on tips, tricks, things either in their physical environment or that occupational environment. We watch closely on early intervention, but we don't really have any leeway because of federal guidelines of Disabilities Act. Any other questions?
You see big challenges with cuts in funding for what you guys are doing?
Yeah.
And do you have plans for how?
We're always trying to think of plan B, C, and D. I think what's really important for us and myself as the executive director is to try to get the most up-to-date and accurate information, and be the calm voice in all of our providers' ears. When news comes out and it's massive panic, especially Head Start, right? And we have 60 families. And so I think what's important for myself and talking to folks and talking to the community is just trying to stay as up to date and accurate as possible. Last week I think I was out most of the day on Thursday and kind of public meetings and such, and got pulled aside a couple times. I heard this, I heard that. And then, I was like, well, fortunately, I've been away from my desk all day, so I'm not really sure what is going on.
It's when you can't get to social media. Right?
Totally. You can't get there quick enough, right? And because we're so reactive right now. And I caught up on emails Thursday afternoon and was like, whoa. The federal offices for the Office of Head Start has 10 regional offices across the state. Effective, I think it was 4/1 in their memo that was sent out to me, that they have consolidated their offices from 10 to 5 regional offices. The 5 that were consolidated were Boston, New York, Chicago, Seattle, and San Francisco. Our regional office is Region 8 out of Denver. So what we expect is their workload to increase, and what they offer to us is training, technical assistance, answering questions, making sure we're, monitoring our program and doing all the things that is asked of us in our federal grant. So I imagine their response time will be a little lagged at the moment, but they gave us some talking points and whatnot, and I wrote those out and sent it out to our program providers. And I think the important message that I said in the email was, we are open, we still care for your children, and we're still a resource. And until I know more, you will, just keeping it an open door, but like I said, being that calm presence that we're still gonna have our doors open and be a safe space.
That's good.
Yeah.
Thank you.
Anything else? I think my next slides kind of talk about, our state and federal funding landscape. So how we put tuition assistance together comes from multiple funding streams, both state, federal, local, Summit County government, and then the municipalities. CCAP is our Colorado Child Care Assistance Program. That is a federal funded program that comes through from CDEC, the Colorado Department of Early Childhood, and then is managed through Summit County government economic security programs. So those economic security programs are SNAP, TANF, and then your CCAP. CCAP has gone through some federal updates and kind of improvements to their program. They pay in arrears, and it's attendance based. So our providers that accept CCAP, they will not get paid until 2 weeks after the month has closed out, right? And so their assistance program, I think their families will wage out around $80,000. And when a family comes in to apply for us for tuition assistance, if we flag them to be like, oh, you'll probably be accepted into CCAP, we have them go to CCAP, apply there, and utilize those state funds before we utilize any of our FPK or First Steps dollars, and use a stacking model, right? So CCAP be the first payer, and then we help fill the gap for those families. With the updates to the federal changes, trying to pay enrollment based and then pay a higher percentage reimbursement rate for our providers, that puts them in budget constraints, right? And so our CCAP office has decided to go on a freeze. That freeze means they are no longer accepting applications or processing applications. So those that currently have an active CCAP case per se will receive funding. And it's really important that when they have reauthorization, which is every year, that they adhere to their reauthorization application timeline, get their paperwork in, and get reauthorized. What happens is that they receive childcare, they go get jobs, and what we call the cliff effect, at times those parents then no longer become eligible for CCAP. The issue that we see is then they wage out, right, and then it trickles down to our First Steps and our SPK funding to kind of help fill the gap there. But the other thing that's important to understand is that we can't get any newly enrolled CCAP families while we're on that freeze. So of course, being a little naive or just always playing devil's advocate, me going to Health and Human Services and say, well, so say we have 5 kids in June that don't reauthorize, can we get 5 more in? Because that would be really helpful. That is not the case. So we really utilize those funds, and it says we serve about 106 children, and that total funding for the year being $517,000. We stack that funding additionally with our Head Start. So someone can be duly enrolled in CCAP, Head Start, and First Steps, right, to help cover the cost across the board. I think that's enough on CCAP for the moment. We're really complex, and I hope I'm trying to do high level kind of overarching on this so you do get the full picture for everybody. And pause me if you have any clarifying questions. Then Head Start, like I said, 25 and 35. Summit County government, I did also forget to mention that we are also an additional subrecipient with Clayton Early Learning Center. They're down in Denver. When there's an opportunity to apply for expansion projects for Head Start and Early Head Start, we're not always seen as a qualified identified area because of our demographics don't necessarily capture what Head Start is looking for because of our higher income earners here in Summit County. So it's a harder picture to paint when you're writing for those federal grants. Clayton Early Learning Center did receive that, and we're a subrecipient, and we receive 11 slots of Early Head Start for them with Clayton. Total funding for that project is about $1.1 million for 2025. 55% of that budget is towards tuition with our partnering contract sites. And then the other 45% is personnel and contracted services to make the program whole. Where Head Start and CCAP come in is that Head Start, of course, does not have enough funding to cover that full tuition cost. And a part of the Head Start program, you cannot have a family charge tuition. So we really try to lean on CCAP to pay the full tuition, Head Start pay that gap, and Head Start SPK or First Steps kind of split that cost. And we have a universal preschool program that is state funded, guaranteed for every age eligible 4-year-old. So those are for every 4-year-old in the year before they enter kindergarten gets at least 15 hours of programming for 10 months. That is a separate application through a state website, a pretty quick questionnaire, 5 questions to determine if they might be able to receive additional hours beyond the 15 hours. So there's 15 hours that everybody gets no matter what, as long as you're age eligible. Then if you have qualifying factors of 5 different categories, and I'm gonna kind of blank on those for the moment, you could receive an additional 15 hours. The 15 hours is about $630 a month for providers, and then $1,000 a month for that 30 hours. What we like to utilize with that is to have anybody, all of those age eligible, kind of flag them and make sure that they're utilizing those state funds that are available to them. And then if they'd like any additional funding on top, they go through our Summit Pre-K application where they disclose financial information to determine their eligibility. It's a lot. You know, it's complex, but it's a fun puzzle to put together, that I say at times. But you know, I think it's important that we're kind of raising the bar for families to access high quality childcare, and then with high quality childcare comes a truer cost of what childcare should cost, so we can retain those valuable teachers, right? And they can continue to show up and have continuity care, which make that high quality environment.
Thanks for that. We all know that there's not enough money there for it in the first place.
Sure, yeah.
That's a tough place to navigate for sure.
Mm-hmm.
And this is Dan next to you who just joined us.
Hi, Dan. Catherine. Nice to meet you. We're hopeful that rates for universal pre-K will come through. I expect a 2 to 3% rate increase for universal preschool, but we're just not sure because of state budget. So we'll see how that works out, but we won't know that until at least July. Our local funding, Summit Pre-K program, those are our 3 and 4-year-olds. We serve 282 children. Total funding that we've spent thus far for our program year, September of 24 to March 25, 1.3 million. Impressive. Families, in order to qualify, must live and or work in Summit County. We see families kind of wage out of our tuition assistance scale at $250,000. Our last income gap is at $230,000 to $250,000, where they see anywhere from 15% discount to a 5% discount. And I say the 15 to 5% because we factor in the quality rating of the program to which they are attending. 15% being for that higher quality and then 5% for that lower quality. One parent must work in Summit County, and the program goal for Summit Pre-K as a part of that strong future funding is to support school readiness for our 3 and 4-year-olds. And then self-employed must maintain an average income that exceeds their business expenses as well as verified business license in Summit County. That's been a real interesting piece of the work in just looking at the financial landscape of our young families in Summit County and just really seeing what people do and looking at all that data. You can really dive deep into it. But our annual reports, I'm not sure if those have gone around, but I should share them with you all yet again, because we put together an annual report of our program and then provider updates, which I can just pass along so you can read through those. Then our First Steps program, which you all contribute to, again, our 0 to 3 age, serving 218 children. We're currently in our 2nd full year of programming. Tuition assistance has been available for 3 to 4-year-olds since 2019 and 20, when we were kind of in full swing of Strong Future. First Steps has been evolving. Like I said, we're in our 2nd year of full programming. It's really exciting, and we're, really progressive and innovative of being able to offer tuition assistance for all ages 0 to 5. I'll probably say no one else in the state is doing a robust program like we are.
And then First Steps, just like a daycare program, or is that like an academic or?
We call it First Steps so we can, I think First Steps being just the age ranges of 0 to 3, and that being more workforce oriented for families utilizing childcare with young children. We partner with our providers that must be licensed and have a level 2 quality rating with the state of Colorado, which is above just basic licensing standards. And that income cap is a little bit lower than our SPK because we're just trying to adhere to working families in that and control our budget a little bit. And we look at, we also take into account assets, not taking into account your retirement accounts or college funds when we do look at those assets. Program goal to support working families for children ages 0 to 3. And then again, the self-employed must maintain an average income that exceeds their business expenses, as well as that verified business license. Both parents on First Steps must work. In order to get full-time care with First Steps, both parents must work an average of 30 hours per week. More. With SPK, it's one parent working that 30 hours. So that's a big difference between that working family and school readiness in the 2 programs. We've been meeting very frequently with our Summit County Tuition Assistance Committee. We're twice a week right now to just be looking at our budgets, right? Coming up with that plan B, plan C, and whatever other thoughts we can. Just knowing what the future holds for us and just trying to make sure that parents are aware, because we are coming into our application season for next program year. And our program year goes from September to August. So it's a lot of planning to get families to apply in the month of May. We hold open applications from May 1st to May 31st, and then review those applications, determine what our pool is, and then hopefully make awards while our partner providers are determining what their tuition rates are and, you know, what we can do to help support them. So we're going over in depth that SPK and First Steps program guidelines. We have directors, eco staff, and then a couple townspeople to make sure that we're just getting the voices of everybody. And then, you know, I make rounds here for town council meetings, managers meetings, and also BOCP presentation to do that. Oh, I skipped ahead. So we're, like I said, getting ready to open up those applications. We offer bilingual support, hopefully some one-on-one facilitation for those that might not have access to a computer, because it is an all online application. And then we kind of host open houses at each of our partner sites to answer questions that families might have, just be there as support and a face to a name, right? When you're divulging so much personal information, I think it's really helpful, and be a trusted partner in that. And then we also kind of update our website with all our program guidelines, FAQs, and just kind of be at call when the phones start ringing and the emails start flying through. And then some next steps we're working towards, you know, like I said, we're working with that committee to identify some needs and possible solutions to control our costs. Working with Summit County government to put out an RFP for a childcare mapping project to look at the next 5 to 10 years, right? The questions I get as frequent as possible: Catherine, what's the wait list, and where should we build our next childcare facility? And that is the hardest data to capture, is the wait list information. You know, we have a platform, but data is only as good as it is in for me to report out. And, you know, through COVID times in 2020, when everybody was trying to move here and get on wait lists, and, you know, I had information that there are 600 children on a wait list. I think that number has decreased in the last 2 years, I would say, with our projects of Wildflower Nature School and then our Mountain Sprouts Academy. We were able to increase capacity with 100 additional slots. So that is more movement that we've had in childcare in the last decade. So we're really just proud of that, and making sure that those slots are full with children participating. Our data shows that about 55% of those enrolled in childcare are eligible for tuition assistance. And on those, you know, income scale ranges, right? And they're receiving an average of about 60 to 65% of their monthly tuition bill through our programs. So we're really kind of, it's like working with the tuition committees, tuition assistance committee, to kind of short-term solutions, get the scope right, so we can make sure to write a thoughtful and thorough RFP, so we can get the data and information that we would like to see moving forward. And here I am, discussions with county and towns to prioritize our funding and increase needs, and then shift while keeping our state and federal changes in mind. And then the little data for you all, Town of Frisco contribution is $325,000. It's 15% of our First Steps budget. And we see that is about 15% of who we're serving in our First Steps program, that 0 to 3 live or work within the 10-mile basin.
Through 2025, we're able to cover that with tax. Nicotine revenue.
If we get more kids smoking, then more.
No, they don't need to smoke, they just need to buy.
Yeah,
I'm just a kind of question for everybody, but like with the nicotine tax revenue going down, do we think we're still gonna be able to fund this amount? And do you need more than this?
Always. You like it more.
Robin, we're gonna have a lot of courageous conversations going forward.
And those conversations are gonna be going countywide. All
Yeah.
communities are.
Yeah,
Yeah,
we're
we're in it
already,
right now.
we're in it, right? And pulling that data and talking about it, right? Each provider that we work with has their own board to which they control their own budget, and increases will occur. Last year, increases for tuition went anywhere from 3% to 10%. And I see that happening again. So even with just tuition increases and not more enrollment, yes, we'll need more. Will we be able to get that? I don't know.
Yeah, and then from a community perspective, I think there's gonna be more and more conversations in the future about fully funding these programs and families to a certain level, but we're not even close to that funding yet, so that's kind of the wide scope of it.
Tom asked all the great questions when we do meet, which I just really appreciate that, of like, what would it cost to fully fund and make it more, that public subsidized? Right now in total, so First Steps program costs $2 million. Summit Pre-K program is about $2.4 million. So we average between $4.5 million to $5 million in just subsidies. To fully fund everyone across the board, I think I did the rough math, 15 million. Right? I think we sat down and kind of did that rough math. So that just kind of gives a perspective of where we're at, of what we're currently doing. And it's amazing, so great, just the progression and where I've sat at early childhood options and just watching the continued commitment from the community to make this a priority is just really special and unique, and fortunate to be part of.
And you can anticipate those kind of discussions coming up in a lot of different programs and services, not just childcare, but as strong communities, strong futures comes up for reauthorization, that we're all gonna be talking about that kind of stuff.
Strong Futures is up for reauthorization in 2028. That is when it will set to sunset, and we're just not sure of what the plan is moving forward. Sometimes the community can think to go a year ahead just to guarantee and kind of funnel out. We've set aside reserves to make sure that shall we not get reauthorized, we'll able to continue our contributions to the tuition assistance program to finish out that year. Because of how our program works, right? We want to make sure if we say, yes, you're awarded this, we can follow through on that program year. And then just my thank you slide.
Thank you. I want to just point out to the group as we have these conversations going forward, one of the things I'm looking for the nonprofit community to look at is the model that your example of taking a bunch of different folks and organizations and putting them underneath your, if you will, umbrella. And then as you described, stacking in those funding mechanisms. We've had the conversation as recently as last week with countywide leadership of Is it better to give everyone $1 or an overarching organization $5? I don't know the answer, but we're going to be looking to other organizations to bring that information forward. And Robin, to your point of we're not going to see a nonprofit that isn't deserving of our funding. But as we build more workforce housing, at the numbers we're going to build it's going to bring more families that can't afford any number of perks here, right? Any number of different things that they're going to need for good quality of life. The county's coming to a really big crossroads on funding and what that looks like. So get ready.
Yeah, we like to stay on the forefront of shared services, and I think that model is something I always lean heavily on in my space, right, of childcare, of how can we combine those efforts, and where can you have cost savings with that of, hey, can we all get the same property management company and go around, right? Can we all utilize the big data platform that EcoSupport pays for? So I'm always trying to think about those things. So in the end, a bulk of our dollars can go back to the community that needs it, the care, the infrastructure, childcare is so important because we know those young children cannot come to work with their direct service parents, right? We tried a little bit. Yeah.
Any other questions, gang, comments? Thanks for all the work.
Yeah, thank you.
Yeah, I can.
Thank you. Thank you.
To a certain extent, it's solving one problem. The whack-a-mole problem.
It's rude.
You want to stay here?
It's going to be very exciting. You have a lot of people in the next few years.
Sure.
We're going to a lot of really hard things.
Yeah.
And not only expendable dollars, but do we really want to do this many capital things, or do we want to do these other things? And where does that responsibility lie? Lots of stuff. Yeah. Hey guys. Thank you, Diane, for bringing up introductions earlier. We didn't do it to our first visitor, and I'm a little bit embarrassed. So I'm just going to start off intros real quick. I'm Rick. Bye.
I'm almost finished. Diane McBride.
Oh, that's what
I'm Brianne Snow. And I'm Carla Decker. I'm Robin.
Andrew Noah, the telemetry. And Martin's chair is turned around. He'll be back.
All right. Well, thanks for having us here today. We are happy to be here with our fellow nonprofit crew. We just wanted to really share a little bit about what we've been up to and why we're commonly referred to as the backbone of the county. We're going to talk through our services, and I heard this is an interactive meeting, so if there's a slide that pops up and you guys have questions and want more information, just stop us and we will be happy to talk through whatever you want to talk about, whatever you want to know more about. Carla picked the photos for this, I would like to say. That is, I made the presentation, I picked photos. Picked a really great photo. I've worked at Burke for almost 20 years. So that is in my earlier days
before I was an executive director and received all of my gray hair and wrinkles. I think it was maybe 2009-ish or something. And then Carla has a great picture saying hi to Senator Hickenlooper. So as you can see, who won this photo contest. I just tried to find both of our earliest photos at Burke, and that one is of me in 2019 before COVID. And I didn't know when that was taken of Brian, but it just looked like a really good photo. It has a little superhero quality to it. This slide we don't need to spend a lot of time on. This is just some of the general themes that we're going to talk about today. Burke's mission, vision, and values. I thought it was important to put this slide in because last year after COVID, we really needed to take a breath and slow down. And at that time, we had just been in constant response mode, and we hadn't done a strategic plan in many years. And so what we decided we needed to do is take that breath. We hired an outside consultant to come in and help us create our 5-year strategic plan. And at that time, we kind of reassessed our mission, vision, and values. And so this is kind of a refreshed mission that's opening doors and unleashing our community's potential to create a diverse and thriving community. And the reason we kind of say it like that is because we do believe that people have their own potential locked within them, and we're just here to help them unleash that. Our values we call the 5 C's, which are collaboration, cultural diversity, community, contribution, and curiosity. And again, those all tie back to our 5-year strategic plan. We are always trying to dispel the myth that our community isn't capable and that people don't work hard or that people only come here looking for a handout. And we really believe that those mission, vision, and values support that underlying theme. This slide just talks a little bit about who we are. That person right there is Alicia, and she's been at work at Burke as long as you. She started out in the thrift store, and she's still working over at the community food market. And so Alicia just really reminds me of who we are and what FERC looks like. We're a really diverse group of individuals. We work really, really hard at our jobs. A neat fact is that FERC staff are 60% bicultural and bilingual, and 100% of the direct service staff are bicultural and bilingual. So it really creates a welcoming environment for people that are trying to access services to see somebody that looks and speaks like them, and to also feel like environments are just welcoming overall, and that we can we see a lot of our staff enter the doors that have no education, but they have lived experiences of navigating and overcoming challenges. And so by employing those people and teaching them skills and investing in their training and their upward mobility and growth really is inspiring to our clients that we work with, because they see a trajectory that's possible for them. This is some of our philosophy on why and how we do things. We just really try to remind people that we're all better together. The community is made up of a bunch of people, and we need all of them to really want to live here. We want to remind people that in this time where everyone is really kind of focused inward, there's a lot going on. We're trying to raise our families, we're trying to do our job. It's just to remind everybody to look up. We don't work and live in a silo. We really are interdependent on one another. And this is a great place to come and feel that people care about the big picture, and that we really truly do value those diverse perspectives. We really try to make sure that we're a clearinghouse for knowledge and information about the community. We really try to keep on top of all the resources and how to access programs and services in the community. We pride ourselves in being able to probably give a fairly good presentation on Building Hope, who you just saw. Catherine Pico, we have before Elevate, because we work all so closely together to make sure that people have the support that they need. This is just a program overview of what FERC does. FERC has a lot of different programs, and there's a lot of programs packed into those core programs that you see there. But really our four core programs are peer community, the community food markets, community health, and financial empowerment. And each one of those programs has a small but mighty team behind the scenes to offer these sub-programs, which the peer community might sound a little confusing to you, but really what it entails is we have a parenting home visitation program that works with 44 children and their families over the course of the year. We have what we call one-on-one peer support programs called Alma and Acción. Those are for Spanish-speaking men and women, ages 15 plus. And those individuals get matched with a peer or a coach, and they get 10 visits to really build community, understand resources, address mental health issues, and really learn how to navigate challenges while most of them are bringing up a young family. We offer support groups and what we call pro-social events. A really fun little futsal tournament has been developing over the last few years that is getting Spanish-speaking men really engaged and building connections in the community. Our community food markets kind of speak for themselves. We have two large public community food markets, one in Breckenridge and one in Dillon, that feeds about 350 families a day. And out of that program was also born a Food Equity Coalition right before COVID. That's comprised of community members with lived experience of food insecurity that kind of guide improvements, break down barriers, and then really connect some of the other food assistance partners in the community on how to build a better food system. So again, that working together piece so that we're not duplicating services. And then very recently, FERC has kind of been the stimulus behind forming a new food access advisory board. And that is comprised of the key food assistance partners in Summit County. So Smart Bellies, the senior centers at the table because they offer Meals on Wheels and Cafe Food Rescue. So those two coalitions really guide our community food work. And then our community health program is a health insurance navigation program where we help people apply for public benefits, marketplace plans, and then we also offer medical bill assistance and help apply for discounted care applications at the hospital as well. And finally, our financial empowerment program does case management with families that enroll in our Housing Justice Scholarship program. And our housing scholarships help reduce the rent to income ratio for people that are experiencing extremely high rents and can't afford to pay for it with their low lived income. And we also do a few other things. We have a workforce rental assistance fund that the town of Frisco did contribute to, that we offer one-time rental assistance to folks. And then finally, we also have a housing justice coalition that guides important housing conversations from, again, that lived experience of housing insecurity bonds. That was just a lot of information in words. So any questions on FERC's programs?
There's like a program for disability community called 99 Balloons. And it's part of it's like a parent support group. I mean, it doesn't quite match what you guys are doing, but I can speak personally, there's a need for peer support in the disability community for caregivers and just any relationships that might touch a person with a disability. I'm just throwing it out there. It could
Yeah.
be,
Did you happen to mention that when Kellen was here too,
Kellen-
from Building Hope?
I did not.
Yeah, I think that that's something that we could talk to her about too. And there are a lot of need, there is a lot of need for that support system and to realize, I think that these groups provide the space to know that you're not alone.
Yeah.
Because there's a lot of navigation in these different arenas. You know, having a member of your family with a disability obviously offers all kinds of challenges to figure out resources. So I think this is something that we could certainly talk to her about. They do most of those support groups in the community that are a little bit away from economic stability, although there's a component of that too. And we'll get more into it, but when we get into the Soul Center, we really have this great ability to have her provide some therapist or peer supported groups and us to come in the back end with some real tangible resources. So that's
Yeah.
great, I wrote it down.
Oh, awesome. I guess it's been like 2 years, but even looking on their website for a therapist that can help a family with I couldn't find them.
Sure. I mean, that is not surprising and also sad at the same time. We're very under-resourced in certain areas.
I don't want to add to.
No, that's the really, it's true. We see it, we hear it. And then, of course, we're all here talking about funding going away and programming going away and resources going away, and typically touching our most vulnerable population, which certainly folks with disabilities is.
Sure. I'm curious if anybody on the Housing Justice Coalition has been involved with any of the countywide and townwide, like housing, affordable housing, workforce housing projects. Has that voice been heard by them?
So they are getting there in terms of being at the table. They're starting to feel more and more comfortable with those conversations. But what we do is take that information and we sit at the table whenever we can. Very simple example of this is the town of Breckenridge was trying to, this was a few years back, and they were trying to encourage Spanish speakers to come to their open house for a new housing project. And they asked us to help translate, and we had flyers, and they had Spanish speakers come, and the Spanish speakers came back to the table, some of these members, and said, it was really great that we had a Spanish invitation, and then we got there and nobody could talk to us. And so it's just really things, people are really trying to do some cool things. And again, this was years ago. I don't want to throw, they were really trying to do this. But these folks can say, listen, we need help from start to finish. And also FERC, you're giving out housing assistance, but you're not really helping us fill out these applications or understand these applications, and that would be more valuable. So we look at our own programs, we're trying to help, but maybe we have the wrong stuff. So yes, even though they're not directly at these tables, one, we're trying to make sure that they are. I hope that the next time I can speak to the town of Frisco that I have a member of one of those entities with me. But yes, we try to pass on that message and really use their voice because they're experiencing all of these things. Or the person that comes in and talks about some of the challenges with the affordability of some of these homes. And so we really work with the towns and the county and developers to get that messaging across, talk about the gaps that we see, so on and so forth. But we get almost all of our information directly from those folks. And it's not only from them, but it's from their community, their friends, their family, Spanish speakers, English speakers, West African, everyone is kind of filtering that information up through some of these advocates on this
committee.
Does Mountain Dreamers contribute to that, like, just all of?
So we work with Mountain Dreamers a lot, especially for, they're really focused on newcomers in the community. And so that's a great place to kind of orient you on what is happening. A lot of the families that we work with have been here for many years, and maybe they've been priced out of their rental, or something's been sold out from under them. And so while we share resources, we don't necessarily always serve the same clients.
Gotcha.
I'm sure there is crossover, but the vast majority of our clients have lived here for 10 years or more. Is that right? Yeah. So, and a lot of them for 20 years or more, and have had kids in our school district. So. A lot of times when we have openings on those coalitions, we send out a partner email and we ask for Mountain Dreamers or Building Hope or whatever to refer a client or a community member to sit on that coalition. So that way we do have more of a broader voice represented and not just a FERC client base represented. Yeah, I think that's a really important thing. We've definitely been trying to make sure that it is more broad than just the people that FERC serves in any sort of venue, because it helps to get a wide variety. And we serve an interesting diverse population. People that come in for health insurance navigation aren't the same people that need the mental health peer support, and aren't the same people who need the housing assistance. And so while we have a good range, we definitely try to work with other entities to make sure that our voice is out. Yeah, some of our community members are just so, they're so foreign to the idea that policy and advocacy from the ground up really works. And so they're just kind of learning how to get their feet wet now. An example of something cool that's happening is 2 of the members that are on the Food Equity Coalition are now on that next level coalition. They're on the Food Access Advisory Board, which is the partner table. So their voice is being incorporated into higher level conversations and plans that are happening at a county level. So that's really cool. Yeah.
Do you see other opportunities for municipalities to help out beyond the cash that we're giving? Like I know we have a bit of an initiative to offer Spanish applications and that sort of thing. Are other municipalities doing that as well? And are there other ways, that municipalities could help?
Yeah, I think that, sharing resources is an amazing way to help. I think being able to pick up the phone and call each other to the county town manager or mayor is really helpful for us to know also what's going on and how to help our clients navigate. But also, if there was an opportunity to apply for housing and it's in you guys are willing to do it in Spanish, then we can kind of help with that, and we can know what barriers they might face and be able to talk to them before they go through the process. I think that there's a lot of value in increased communication. I do think that there's been a lot of turnover and movement in the community in the last several years. And so getting back to those that communication where we all know what's going on and we can really say, hey, can you help me with this? I think that you have a lot of resources as a town that we don't have, but I also think we have a lot of resources that you don't have. And so to be able to share that is, I think, really great.
Right. And, we hear stories of Summit County having a hard time filling the lower end of rentals and all that sort of thing. And it's kind of like there's demand, and somehow we're not.
Yeah, but there's challenges.
Pieces together.
That maybe we can help you understand what those challenges are and what, I think that there's a lot more that can be done. And I think that's mostly through communication, which is largely free.
Yeah, that's fair.
Yeah. The next slide can help us kind of understand why we have all of these programs. So this is just sort of a snapshot of who we are serving. You guys, I think everyone knows about 30,000 year-round folk live here. Our average household size that we serve here at Berger is 3 people. We know from the self-sufficiency standard that those 3 people need to make about $103,000 to not rely on any public service, and have a savings. I mean, that's fairly significant, because of our cost of living being so high. If anybody's been to the grocery store this week, you can feel it. If anybody's paid their rent this week, you can feel it. If you weren't lucky enough to maybe purchase a home, 10, 20 years ago, it's really cost prohibitive. Our average income is around $46,000 for that family of 3. And so while we're over the federal poverty level, you can see that there's a big gap in terms of making enough income to really make it here. And so that's why all of those programs are really important. The only county that's more expensive to live in Colorado is Pitkin. And that's quite we're up there. And I think this kind of demonstrates that little post-it on the side. Summit County families need 3 to 4 times the federal poverty level to be self-sufficient. So it just really shows that our families struggle, and those same families don't qualify for federal programs because they make more than the poverty level, and so they're just sort of in this middle ground. While some options are available to them, not all of the options are making it even more difficult to live in this community.
Definitely a challenge with our AMI scale.
Correct.
And then people with combined incomes or not, or
That's
they
right.
earn too much, but they don't actually earn enough to get by, and then it's.
Right. That's exactly
And I
that
hope
Clifton
we can
talked about.
address that stuff, ourselves.
Yeah, there's social problems that come along with that you don't even that we see a lot of too. Maybe you're in a relationship that is really unsafe for you and your child, but you stay in that relationship because without that income, that 46 turns to 26, or even less. And so there's a lot of issues that we see that this does paint a picture, but all these numbers are people. They're real people, real families. They're really trying to figure this out, and a lot of people are really truly struggling. This is another slide that kind of talks about that as well. The United Way of Colorado put out this new data set called ALICE, and what ALICE stands for is Asset Limited, Income Constrained, Yet Employed. And so that just means that people that are classified as ALICE are earning more than that federal poverty level, but not enough to afford the basics where they live. And what that data found specifically for Summit County, you can drill down county by county in that Colorado map, is it says that Summit County residents are largely employed at 76% here in Summit County, which is higher than the state average at 69%. Yeah, ALICE households, 32% are ALICE households, and 6% of families are living in poverty, which equals 37%, or 2 in 5 of people in Summit County are classified as ALICE households, can't afford the basics where they live. That's right here in our back door, and that's really sad and upsetting news, and I think it's only going to get worse. I just made a few notes here that say ALICE workers often struggle to keep their own households from financial ruin while keeping their local communities running, which I think is a lot of the workforce that we see here. And that financial hardship is usually not equitably distributed. Usually we're seeing, people of color, single parent households, and those that are falling into these categories. A small portion of the adults in Summit County are unemployed. However, a substantial portion of both full and part-time workers are paid by the hour, and those workers are more likely to have fluctuations in their income and very rarely receive benefits. And so that is a huge issue that we see a lot of our clients walking through our door with, and that's some of the things that our programs are kind of shaped around trying to address. I don't even need to say any more about the nature of seasonal employment here. You know, closing of Keystone on Sunday. We had a really busy Monday with the phone ringing off the hook because people don't know what to do as they move into a period of what we call mud season, but which is really a scary time for a lot of folks that are living in this community. FERC's impact. This is from our fiscal year 2024 annual report. Of all of those 4 programs that are running and operating in Summit County, we served just under 8,000 people that were affected by our programs, impacted by our programs last year. And that is a total of over 32,000, 33,000 service deliveries. A service delivery is just a touch point where people access programming. So we have a lot going on last year, a lot of people that we're talking and working with, and a lot of programming that's happening behind the scenes. It's just showing that we're continuing to support people who live and work in Summit County to keep our community running and strong. This is those same 4 programs broken down, and those service deliveries and touch points broken out by program. We had a lot of money that went out the door in our housing scholarship and rental assistance program, just about $500,000. But we did way more in food. We distributed over $5.8 million back out into the community in terms of free food at our community food markets. Well, that's pretty amazing. And then I wanted to put one specific slide in here specifically about our fresh food markets because it is a really great investment in our community. We can turn a $20 donation into over $200 worth of food. And so the impact is just astronomical in that program. We've got people from all different walks of life coming into our food markets every day to get food. You can see the trajectory there from pre-pandemic to 2005, but we're already on track right now to exceed that 31,500 visits to our food markets in 2025. It'll probably be more like 35,000 visits to our food markets. And the reason people love coming to our food markets is because we have a really cool online ordering system. It works similar to Instacart. So clients make an account and they get points and they can shop with those points for food that they want, that's culturally responsive. They can, adjust their dietary restrictions. They can pick things that make sense. And over 85% of that food is fresh. So we don't purchase mac and cheese and rice and beans and things like that. We really focus on ordering fresh produce, dairy, whole grains, meat. And we have a lot of baby products too. Diapers are some of our most popular items for people to shop for. And so people can pop onto this online system. It takes 5 minutes to put items into your cart. You click submit and you pick an appointment pickup date and time. And so it's really handy dandy. A client can just zip over to the food market on their lunch break, and in 5 minutes they're in and out. They've got their box of food packed up, and then we also offer a grab and go lobby that has a lot more rescued food and food that is prepackaged and prepared. And so a lot of times they come and they get all that fresh produce, and then they can also grab a dinner that they can just pop in the oven and reheat that night. And so it's a really great resource for community members. And we have seven bicultural bilingual staff people now. And a really cool thing that I just wanted to point out is we recently hired a new food market volunteer coordinator who is from the West African community, and she speaks French. And so she's been really connecting some of those individuals that we've been struggling to work with to a lot of really good resources through that program. I think one of the questions that we sometimes get asked is why do we buy fresh food? Because it's more expensive. And why don't we just buy canned food? But if you think about the population that is accessing this, we really need them to be healthy. And that's the one thing that we can do to help them. If they miss work, it's astronomical for them. It's a budget killer. They're hourly, they do not have vacation time. They could potentially even lose their job, but certainly lost wages. And so it's really important for us to focus on making sure that our most vulnerable members are getting access to healthy food. And that food equity committee that we talked about really said, after in 2020, 2021, we can afford a can of green beans. That's what we can afford. What we can't afford is a gallon of milk. We just can't. And so we really try to leverage partnerships that Bank of the Rockies and other companies to be able to purchase that quality, healthy food so that people do have access to all of the vegetables, the dairy, the meat, the things that they can't afford at the grocery store, especially now. And if a family or an individual were to shop once a week, which is what we offer, they could save almost $1,000, and they can redistribute that money back to their rent, back to medical bills, back to insurance, whatever it is that they need. And so while rental assistance is really important, we're going to continue to offer that. That's a 1-to-1 return on your investment. Whereas as we can, like I said, we can turn $20 into almost $227 worth of food. And then that family can go back and really, really make an investment in trying to save money and turn their life around just by accessing that food market 4 times a month. Next. So this talks about just our food market revenue sources. We try to diversify our funding so that if any funding does go away, like so many people are facing, that there's a little bit of cushion. As you can see, for me, I've always complained that we do not get any state or federal money that goes towards food, which has been really historically difficult. Right now, it feels really good because we're not going to get that money cut. However, it doesn't mean that we're not going to feel that. Food Bank of the Rockies, where we get most of our food purchasing power from, is facing all of those cuts. And so any free produce that we were eligible for, or any sort of discounted food is not going to be as plentiful as it was. We don't know what that is going to look like, but that is certainly a consideration as we're planning moving forward. So while we are happy that we do not receive state and federal funding for our food markets, we do for other programs, because this is so important to the community. We are watching very carefully about what that means. Obviously, the cost of food is a big factor too that we're watching pretty carefully. I think we're all watching that in our own homes as well. I did want to talk about this slide though, because it costs about $1.2 million to operate our both food markets for the year. And we write a ton of grants. And so we have about $700,000 designated to food, which is really exciting. However, that leaves about $500,000 of us trying to figure it out above and beyond the grants that we're eligible for. And don't worry, we ask everything. So the next slide, I think, is actually a happier slide because it shows that I think the next one's yes, this is where you guys have really kind of come in. So we have happy news. The town of Frisco's impact has been really meaningful because you guys give us $117,000 in nicotine, which goes directly to fill that food market. We're able to designate that money how we need it. And as you saw from that $500,000 gap, that is really important to fill that. It's actually the only way that we have been able to keep up with the demand and keep up with the rising cost of food. So that is just something that we definitely wanted to come here and say thank you for. We help with a couple of events, and then I came to, Tom probably remembers, I came to a mayor's, managers, commissioners meeting and told folks about, I guess it's been almost 2 years ago, that we had a pretty significant deficit in our budget, it was last year, sorry, for food. And the town of Frisco gave us an additional $50,000 to fill that deficit. And we were able to leverage that money to not only fill our deficit, but to get some real promises for the upcoming year. And so it's just really inspiring how we've been able to work with you guys. And so I just wanted you to know, you can think back to all those slides. I know you have them in your computers, but you helped that happen. We could not do that work without everyone in the community helping us. So that's really important. So this is some of our staff. We're a small but mighty team of just over 30 people, and we serve 8,000 community members. So that's about 267 households each person each year. It's a really busy office and a lot of pride and a lot of trying to navigate everyone's situation that walks through the door. But those folks are really amazing because they meet people where they are in their most tough, just trying time. And they turn it back on our clients and empower them to be able to make the changes to take control of their own family's future. That staff doesn't do things for folks. They really empower folks to understand how to navigate their challenges. And so it's a great team and we're really lucky to have them. And that's also a really fun event that we do every year over at the Frisco Adventure Park, because you all donate a tubing day for our staff to be able to get together and have fun. So I wanted to share that photo with you all. So after 30 years of Park being open, we are just really proud of all that we have accomplished. We also, you may have heard, we are getting ready to move into the Soul Center. We are fully funded and looking forward to consolidating all of our efforts all across the community into one building that was actually designed for us. You can imagine, I've been with Brooke for 20 years. You can imagine the different spaces and places that I've been. At one point, I worked a lot of different positions throughout, and at one point I was managing the program that does home visitation, and all the home visitors shared one computer that was in the closet of a very small closet food bank. And so just seeing and being able to have the community support so much in-kind support to build this, and it's for us. It's designed to be efficient, it's designed to save money, and it's designed with kind of what you guys spoke to Catherine about in mind, is those shared resources. We're moving in there with Building Hope to be able to become more efficient as and sharing resources between the two entities, which I think is really important. We've already started practicing by sharing a database and making sure that that it's cost effective and that we can share ideas and resources. And then some of the things that I was just speaking to you is really partnering to make sure that they might provide a therapist or peer support, and we can provide some real tangible resource information. We just are really excited to provide a safe and welcoming environment to anybody to walk into anywhere they're at in life, and to be able to ask us for help and ask us which direction to be pointed in. I think it really speaks to the fact that the community can count on us And we hope that clients can count on us, but also feel as a town entity that you can call us and talk to us and count on us as well, because we're all in this together. And I just wanted to mention that that building is going to be really neat because currently we're spread across 5 different locations all over the county. And so sometimes the client shows up and asks for something and we're like, nope, sorry, you have to go all the way over here on a different day, ride the bus 3 different times to get this other need met. And so by having all of these services under one roof, it's going to be really great. Something exciting that she didn't share is that we will be eventually reopening our thrift store, which will be a really great opportunity for clients to be able to come in and get basic clothing needs and household goods met. Go across the way, there'll be a full functioning food market there, get a box of food, and then they can zip upstairs and have an appointment with their Building Hope therapist or whatever else at the same building. And so it'll be really amazing to see our client get all of their needs met in one day and one appointment at the same location. And then maybe even see them skip across the parking lot to their house at Vista Verde. So it's going to be really amazing to see that come to fruition, and we couldn't be more excited about it.
Where is this located now? Sorry.
Go ahead.
Where's this located now?
It's being built right now, right next door to the Breck Building Center.
Okay, yeah.
Mm-hmm.
So
For
with
some
you,
Mesa Verde, I thought is that Silverthorne, Mesa Verde?
Vista Verde.
Oh, Vista Verde.
Yeah.
Okay.
so with you all being in Breckenridge, will there be any sort of food access Silverthorne or other parts of the county?
Yes, so we will have a satellite location over on the north side of the county. We've had 2 food pantries traditionally on both sides of the county because all of our services you can access via phone or over the internet or coming in, but obviously food, you can't zap that into your house yet. And so yes, we feel like it's really important to do that. We have a location right now in the town of Dillon that will stay open, and then eventually that facility will downsize and move over into the town of Silverthorne. We're working with to provide space for us as part of this. We did a massive community needs assessment when we embarked on building this structure, and what we found is that while a lot of our clients live on the north side of the county, most of them work on the south side of the county. And so we wanted to make sure that they would be able to access our services if we were primarily located more in a middle ground, honestly. And clients are going to be going back and forth between those 2 locations so frequently that they didn't express that they would have any concern accessing our services there. But yes, we do believe it's important to have that Silverthorne location for the satellite food market. And we envision that to be a really tech savvy, high functioning place where we won't have to staff it even potentially. And we're thinking like refrigerated food lockers and really interesting technology and efficiencies. So that way, again, we can infuse those saved dollars back into other necessary programs and budgets that we're trying to fund.
So if I could inject, we're a little over time. So if we have any other highlights or any other questions, gang.
Just have one comment, Mayor.
Please, yeah.
I can't say how much I appreciate work. I got here in '94, and that's about when work started opening. Luke Slaughter was a good friend of mine. He gave me my first job. Your former marketing manager, Anibert Obermeyer, was my roommate for about 7 years. So I got to see a lot of growth firsthand. And I just can't believe how much you guys have done. And it's just, I don't know, I'm happy to be in a position here on town council to be part of that support team too. So thank you for everything.
Thank you.
Any other questions or comments?
I'll just say thanks again, you guys. I said it to the other group, but I'm really focusing on the organizations that are collaborating the resources and the dollars that we have on common missions under one umbrella. So thank you for that.
Yeah. Thank you for your time. Thanks, everyone.
Thank you.
Get really strong. Oh, thank you.
Feel free to get started since we're behind and all.
Yeah.
All good, yeah. So thanks you guys for being patient. It's always good to hear more from the and all the programs they have going on. So with that, you guys, we have Elevate. I'm entrenched in the old name. Elevating Community Health. And with that, you guys, we've been doing a round of introductions. I'm Rick High.
Josh.
I'm Sarah.
Dan Gibby.
Thanks, guys.
Barnell.
I'm Robin. Awesome. Good to meet you guys. Well, yeah, so you guys formally know what the Summit Community Care Clinic is. Been a week and a half.
Yeah, too. Yeah.
So it is very fresh. A lot of people do not.
So you'll be fully offended if we miss it.
Yeah. I know, even for me, I feel like I have to introduce, I'm like, where's the care coach now? I need to like do an adjustment. But yeah, just similar to the other organizations, we just want to provide you guys an update, share what we're doing, and just how you guys support us, and just so you know how we're in the community. Okay, there we go.
I've met a couple of you. I know Mary and we've met a couple of times. I'm just curious, were any of you at our soup event, our soup fundraiser? So some of you might have heard my spiel, so you might have heard my spiel on stage. And so we moved out here in 2020, my husband and I, from New York City. This was my first job in nonprofit healthcare. I've always worked in private equity healthcare companies, portfolio companies my entire career. So I ended my career on the East Coast. Grew up in Florida, spent some time in North Carolina, and in New York for about 10.5 years before moving out here. So I was on the board for 2 years before moving into the CEO position in September. And again, very informal for us. And I apologize for my informal appearance. I hate being so casual, but I couldn't find many pants that fit over this splint on my foot. So I had surgery last Wednesday. So yeah.
It's a good thing you're in healthcare.
Yes.
I purposely work in mountain towns so that
It's a nice change from New York where I was in a suit and tie.
Yeah.
So, yeah.
I know he started, and he's like, "This for Jean every day." I'm like, "Yeah." Yeah.
We just had our pictures taken. I was the only one that dressed up. You guys.
It's my here.
Just in case anyone who doesn't know who we are a federally qualified health center, which essentially means that the federal government recognizes us to provide care to all, no matter their pay. We are a primary care provider, a behavioral health provider, and an intensive provider. And then we provide all those services in many clinics within 7 schools, like full schools, and then all other school types. We at least have behavioral health and dental screenings. And that's across Summit County, Lake County, Park County. So our main offices are here in Frisco at the main MOB office. That's where we have 3 different offices, one for dental, primary care, behavioral health. And so our mission is to provide exceptional integrated patient-centered care that's available to all. All those 3 service lines work together to credibly care for that, holistically for that person. And I guess just as a comment, I know Kirk also said this, we love for us to be interactive, so feel free to ask questions, having more of a conversation versus a lecture. So just want to jump in. Well, just so you know, this is our new logo. We already kind of mentioned it, but we are officially Elevated Community Health, and we often are getting asked, so why the change? And so partially because we don't just serve Summit County anymore. Our range is a lot bigger than that, and we just want everyone who we serve to know that they're inclusive for who we serve. And then also, our logo's a little outdated. We've been around for 30 years. So just time for a refresh. And also, we just want to make sure everyone knows that we're a quality provider for all, not just those who are low income, which we obviously have great programs. We really care about that population. But we care for everyone, not just one sliver of the population. So we're hoping that this new name and logo just kind of helps show the community that we are quality care for everyone in it.
we want to really expand our reach and who we're seeing as patients. So, I've said this, we were presenting to Dillontown Council 2 weeks ago today. And so I did encourage everybody to become a patient. I'm a patient of medical dental. It's fantastic here, second to none in my opinion. So, and I just would love for us to serve the community where we're getting so much donations and support from. So I just would encourage everybody to become a patient there. There was one individual, I'm not going to say the individual's name, but it was one of the newer town council members who was just sworn in that meeting, and that individual did not know who we were. And that was even with our old name, So, but that individual was interested in becoming a patient. So I encouraged him, and I said, if you had difficulty getting in, just tell him that I referred him. Right? So try and get in and use my name if you can, if you need to. So,
Yeah.
Just as a, if you accept a fully insured patient, how does that help you?
Well, that's a great question. Actually, someone brought this up at the Rotary Club more than once, and I was like, that's a great way to look at it. She essentially looked at it, not only do we receive your insurance reimbursement for those visits, but that insurance reimbursement helps us also serve those who don't have insurance. So I feel like not only do you receive quality care, but then that $200 we might get for your visit while you're paying your $30 copay, that $200 helps us then continue that care down the line. I think we get to it, but essentially our revenue breakup is about 50 to 60, 55% or so grant funding and donations, with the other 45% made up by patient revenue. And so, which again, we'll get to this in a moment, but we see a little bit more than 50% of our patients are uninsured. So us having people with private insurance and Medicaid coming to us helps bring in that 45% of income we need so we can serve those who are low income.
And we are higher than the typical FQHC across the state. So there's 20 FQs in the state. We're one of those 20. And typically you see more revenue coming in from patient service revenue than grants. We're about 60-40, as Sarah was just saying. So almost 60% of our revenue is from grants. So that does put us at a lot of exposure, depending on what's happening in Denver, but also in DC, right? So we want to shift more to productivity and patient service revenue and relying less on grants.
Yeah. So here we go. Here's a little bit of breakdown of it. So specifically looking at our population of who has a Frisco address, we serve out, in 2024, we serve 955 Frisco residents. Of that population, you can see 42% were uninsured and 34% lived at the 200% of FPL, and then, or federal poverty level, and about 65% identified as Hispanic Latino. So that population right there is specifically looking at Frisco residents. And then the data below is looking at our just patient population as a whole. So you'll see that we have 52% of our patients are uninsured. And so we have a care card program, or elevated care card now, where essentially if you are below 200% of the federal poverty level, you qualify to receive our services at a discount. So for example, if you were to come into our primary care office and you live at that 100% or lower, your visits are $20. But obviously us paying that provider is more than $20 in the MA and the PAR and all those positions. So that's really where funding from you guys and grants and private insurance really steps in to help us out. Just as a big overview, in 2024, we served a little more than 10,000 individual patients, and then that amounted to about 32,000 visits.
37, just over
37, you're right.
Yeah, billable visit for 2024.
Yeah, those are individual.
And that's across all of our sites of care, about 18 sites in total.
Yeah. So again, just looking at our data through another lens, and these are specifically here of our sites in Frisco. So we have our main sites, as I mentioned, at the MOB, and then we also have school-based health centers. And again, those are those like mini clinics located in the schools. So in Summit Middle School, we have a primary care provider there 2 days a week, behavioral health providers. I think we actually have one who's there 4 days a week and another one that's there 2 days a week. So every school day has a provider, a behavioral health provider. And then I believe a dental hygienist goes 1 to 2 days a week as well. And then at Frisco Elementary, we do have a behavioral health provider and we do dental screening.
there for all this too.
And I'll just share that I'm a big proponent and a big supporter of our school-based health centers. I know there was some discussion in the past here at the organization about, does it make sense to keep these open? They're not really revenue generating for us. I mean, they do generate some revenue, but we do rely heavily on grants to make these operate. And I do know that our partner FQ out in Glenwood Springs had to close a couple of their school-based health centers in Basalt, I think at the middle school and the high school. So, but I'm fully committed to making these work. And so we did just hire a new school-based health center director from our partners here at FERC. Hannah Gall is our director for school-based health centers. So she started with us on 3/31, but I'm very supportive of our school-based health centers. I want to see them grow because we have access, in these school-based health centers to see more kids.
Yeah, so in our middle school and high school age, all of the students can be seen without a parent present. Parents are welcome to come in, of course, for appointments or telehealth in. And at all the elementary schools, again, for primary care appointments, we do require a parent to be present, but that could be via telehealth. So it is really keeps kids in school and also eliminates those barriers where parents don't need to take off time, go to pick up their kid, drive them to the doctor, and so on, which is really awesome. And visits in our school-based health centers are never more than $45, no matter if it's private insurance or anything. And so it just really eliminates the financial aspect as well. And in them, we can see all students enrolled in the school district, all staff of that school district, as well as any family member. So if you even have a cousin in the school district or a niece or nephew, you qualify to be seen there. And it can really help you get in instead of waiting 3 months for an appointment. You can get in next week. So it just really increases that access.
And one more point here, we were doing a presentation to a different town back in December, and one of the individuals in the room wanted to know if we hired the nurse, and we just employed the nurse. And we don't employ any nurses in the schools. That's not what we provide. So just educating them on the services we do provide, we're providing actual providers, master's trained BH clinicians, dentists, hygienists, and medical providers. So we aren't providing any nurses in the schools, only licensed, medical professionals and dental professionals.
So that's when you go to the middle school and you go in the
Yes.
nurse's office.
That's not our employees, right?
Oh,
They're not the
okay,
nurse.
it's a separate.
It's a separate, yeah. We work closely with the nurse, but yeah.
So the nurse is gonna see like, oh, I just hit my head on the playground, or it was boo-boo. Well, then our providers are doing strep tests and providing wellness exams. And if you have a concussion, we're doing your concussion follow-up. And what you go to your primary care provider for, we're literally just doing that in the school.
Yeah, I had no idea. My kid's in 7th grade.
Yeah.
He's hitting his head on this.
The
boy.
Right.
Yeah.
Yeah, so some of the accomplishment here. So again, I've been here about 6 months in this position. Again, I was on the board for 2 years. So I really hit the ground running with kind of the areas of opportunity for me, as what I saw with kind of my background, my training and things like that. So, increasing new patients, we did that in 2024, as well as patient visits. A big focus of mine was on wages. We weren't paying, and it's not a living wage yet. But I did announce this at SUB about a week and a half ago, but I have raised wages for 82 of our 122 employees since I've been there. And I have plans to raise all wages by July 1st. I put that into our budget for this year, and that means everybody's getting a competitive wage by July 1st. I've also raised our starting organizational wage from $20 to $21.50. $21.50 I still think is a tough living wage out here, so I'll keep working on the wages. I've also improved our benefits. We did a staff survey late last year, got some feedback around our PTO package not being sort of rich enough, right? So I did look at the data from 60 other FQs in the Mountain West that we get from an organization called CHAMPS. And I did see that we were paying a little bit too less in terms of offering PTO. So we offered one additional PTO day for every employee, as well as adding a floating holiday for the first time. That's a common thing I could see in FQHCs was offering a floating holiday. So we offered that as well. We did reduce the high deductible health plan out-of-pocket amount for that for employees who have that high deductible health plan. We also increased the 401k, and so now the employer match match starts at 90 days versus 365 days, after 1 year. So we moved that up, to 3 months instead of, 1 year. And then everybody's enrolled automatically at a 3% contribution level. And that's how you really lift your employees up, right? So automatically enroll them in a 401k plan and not make them opt in. So they can opt out if they don't want to contribute, but they're leaving money on the table if they don't get the match, right? So.
Yeah, we really have a philosophy of we can help support our staff and keep them in place. Our patients will have better care, more continued care that's not interrupted, and just really support them. And I always like the retention rate. It's
Yeah,
really
and I'll share that. That's not on the slide. But yeah, our voluntary turnover rate in 24 was 39%. That's extremely high. And it's going to always be higher in healthcare, kind of in COVID, post-COVID. But so far this year, as of last week, we're at 4.3%. So come down, substantially from the 39% we saw in 2024.
I love that you guys are focusing on this because I think that's something that we just don't see in nonprofit work. Like when you're serving people and you're hardly making ends meet yourself, it's going to affect the client.
Of course,
and the patient.
it turns over, it decreases access. I want to expand access, and I can't expand access if my staff keeps turning over, right? So,
Well, that 39%,
yeah.
your management is doing nothing
Yes,
else.
right. And management's turned over almost entirely, except for Dr. Cowie, our CMO, our Chief Medical Officer. Everyone else is turned over. When I was on the board, everybody turned, but Dr. Cowie. So she's been the anchor there in the C-suite for 13 years. And I'm not going anywhere, so.
It's really got a really solid team.
Yeah.
But of course, we do have challenges, just like any nonprofit. One of our big challenges, and this is kind of part of our name change, is there's this big misconception that we're only there for those who are financially struggling. We often hear people say, oh, when I lost my insurance, I went there and you guys were wonderful. And you're like, well, we can keep seeing you. And as a federally qualified health center, we're actually held to a higher standard than your normal primary care provider because we are required to monitor. Literally, I think around 100 quality metrics and prove that we're helping people with hypertension close those gaps.
So somebody on our health plan, if we do a search within our system for a provider, are your providers coming up?
They better be. I don't believe there's a single insurance that we do not take.
Gotcha. Okay.
Yeah. And then again, this is also mentioned, we do have a heavy reliance on grant. Close to 60% of our expenses are covered by grants. I believe we typically have around 50 active grants at one time. And across those, 32% are from the federal government. So those are across, we do, as a federally qualified health center, we do get some base funding that generally is standard, kind of remains constant literally for years. It doesn't grow with inflation. But then we also have some other programs. And so definitely for reading the news a lot and staying engaged there.
And for a comparison purpose, 50 grants is a lot for an FQHC to manage. We're one of the sort of the most prolific in terms of FQs across the state. For a comparison, I know that Marillac out in Grand Junction, they're a little bigger than we are on a patient operational level, and they manage 19 grants. So we're seeing more than double their grants, right? So we have a lot of exposure and risk if grants, were to cut or to be decreased.
Yeah. And then as you can see, just in 2024, we had a 4.5 increase in uninsured patients. And that there's a lot of reasons for that. One, Medicaid, public health emergency ended, which is kind of to the next point. As a result, we did receive 11% less in revenue from Medicaid. And then, a 9% increase in uninsured visits. So really having Medicaid decrease, people not being able to afford insurance or coming, Burke kind of alluded to this, but it's true, we have this middle ground of people in our community who they make too much for Medicaid, but they still can't afford insurance. And so then that's a lot of people that we're serving for healthcare, that then we're writing grants to help ensure that we can provide those services at an affordable rate.
And that next bullet here about the cost of living, so we all deal with that, right? And what we see mostly, at least since I've been here in this position, is we've seen more candidates turn offers down that are sort of at the APP level. So like a nurse practitioner, a physician assistant, even doctors and dentists, hygienists, DH clinicians, so because they come out here and they see the cost of living being so high. And I know that some of our salaries are competitive, like on the BH space, and our APP salaries, but they can't come out here and start a family with 2 or 3 kids and try and buy a house if they're making 150 a year, right? So that's tough, I think. So I'm working on that, and we are looking into offering a provider incentive plan. From my history and my background, providers have always been on a kind of a productivity incentive plan. I have had conversations with the C-suite about that and our providers, and so there is interest in that. So I think that can help kind of, again, expand access while putting kind of more money in the pocket.
Yeah, and I mean,
Is housing one of the big issues?
Yeah.
Oh, yeah.
Yes.
It's really shocking. We'll have people go all the way through the interview process, and then they'll be like, at that point, they then look at housing.
We've encouraged them earlier in the
Oh, yeah.
timeline, like, look at housing, and like, oh, I really look now, and I can't afford 1.9.
Yeah, you're like,
Yeah.
and then that just feeds into our school-based health centers. We are struggling with some of our school-based health centers and just having them fully staffed. So we're really working hard. We're even working with a recruitment firm to hire some APPs and other staffing positions that are just been really challenging, just to make sure we can be open.
So this is exciting, pediatric dental practice. So I've been working with Dr. Malcolm Strange. He's the only local pediatric dentist in the county. There are some general dentists in the county who see kids, but they can't call themselves pediatric dentists technically because they didn't have the additional training to be a pediatric dentist, as Dr. Malcolm Strange does. So he's been out here for about 20 years. He's in the medical office building on the 3rd floor. Great guy. He told me back in December, one day I met with him in person, it was his 82nd birthday. He's still driving out here 3 days a week to see kids, which I applaud, right? I don't want to work at 82, but I think it's great what he's doing. So we're trying to take over that practice. I've been working with him since December on this, with our lawyer, with the landlord over there, with Dr. Strange, of course, on this, my board, just approved this last Monday, 3/31. So very excited about this. The hard work now is trying to find that pediatric dentist. So we do have one sort of on the hook that we're speaking to. She takes her boards May 5th. We'd love her to come back out here to Colorado and then work for us here to be our pediatric dentist. She'll take that practice over. So had a call with the broker today about this. So trying to take that practice over starting this summer. But we are looking for some support. We can talk about that in a future meeting, so not this one here, but yeah, so trying to take that over this summer, but very excited about that. He has 1,244 active patients in his practice. So lots of kids will lose access to a pediatric dentist if they still want to see that level of care, or they'd have to go to Avon or Edwards. I'm sorry, Avon or Evergreen, excuse me, to see a pediatric dentist. So yeah, we're trying to make that work. We did finalize our 3-year strategic plan in January. That work started last summer when I was on the board. I did a revamp there of the process, but our 3 pillars are access, stewardship, and quality. So excited about that ask yourself, so yeah, so I can talk more about that, but I know we're behind schedule. So we're also going through an electronic health record implementation. For those in healthcare, that's a heavy lift for any organization, any hospital, outpatient clinic, et cetera. We started that onboarding back in October. We go live in June. About 740,000, I believe, was the cost. And that's it's called OCHIN. And OCHIN is what Epic calls their FQHC module. So it's meant for FQHCs. It's built on Epic, which is the gold standard for EHRs and hospitals. So very excited about that. We'll be the second FQ in the state to go live with OCHIN when we go live in June.
And with that, I'm sure many of you have ever been to a hospital here, you have your own MyChart portal. So we'll have that as well for our patients. So they'll be able to access all their records through that portal, communicate with their providers, pay their bills online, just really increasing that ease of connection with us. So I personally am super excited about that.
And Common Spirit uses Epic, and I think Bill Health is migrating over to Epic, So again, big investments for health systems, and we're talking in some cases $1 billion, depending on your size, right? So, but yeah, excited about that, and that way you can have the providers communicate and see the medical records, right? And you can book appointments, pay bills, all that, communicate with your provider in MyChart. So excited about that. The patient assistance fund. So this was a very nice surprise we got late last year. And then I met with Sarah Taborski. She's the one who donated the funds, $125,000, one of our single biggest donations ever that came in the last 2 months. I got the check in February. So we named that fund after her. We've never had a patient assistance fund. And that's to help our patients with their out-of-pocket medical expenses. So the board has approved that. We've launched that now. So excited about that. I'll move into the next bullet here, the improved billing and collection. So I made a change on this pretty quickly, notifying our internal RCM revenue cycle team that I was going to be making a change there. We had a lot of issues with billing that goes back years. So we did rebuild 2024, which really pushed our 2024 fiscal year into a healthy positive margin. We just have to collect that money now. So that's underway, but excited about the changes there. They've been doing our dental revenue cycle billing for about 1.5 years now. And the person who started the business, I don't know, 6 or 7 years ago, she used to be our director of RCM years ago, but started her own business. She now does billing for an RCM function for FQs in 9 different states. So very successful with what she's doing. And we're seeing some improvements now with our billing and revenue cycle function. And then Medicaid enrollment. So we are, we have launched this software now as of April 1st. So just implemented this software called Point Care. That just helps us ensure that patients who fell off the Medicaid rolls get added back to the rolls. So it's using software as opposed to just having the paper kind of human component. We still have our internal, payer enrollment team and Medicaid enrollment team and all that. But this will just help us be a little bit smarter, a little bit quicker with the automation here.
Does that renew can you do your renewal?
You should be able to do your renewal, yeah. And that'll flag all that if somebody falls off the Medicaid roll, yeah.
From my understanding, a lot of people with Medicaid don't know when they use it.
Right.
So this will help ideally people not use it. And then they have to reapply and do all this stuff, you guys, Town of Frisco has just been tremendously supportive, and we're just tremendously grateful for all you guys do for us. We are recipient of the nicotine tax as well. In 2025, almost 60,000 we're getting from you guys. That's making up our funding. And then we have been a participant in the concert in the park. And also we are a recipient also of the Frisco Adventure Park. We're super excited. We had our staff party there in December, and I think we surpassed the capacity. Everyone showed up with their friends, and it was awesome. And so we actually wrote for it this year, and we're super excited that we'll get that for us. Our staff recommended it, and they're just amped about it. Loved it. So thank you for your just continued operations and just support and caring about who we serve. And then, of course, there's always more ways to support. As Josh mentioned, with the pediatric dental practice, hiring a pediatric dentist is very pricey price tag. And then in this space, just the reality is there's a new rent. There's all these expenses that we weren't planning in our budget, but we don't want to see this practice go away. And so it is something where we are specifically reaching out to all the towns to see if there's just anything little that can be given to help support the acquisition, to help with that year one amounts as we build that clientele. Hopefully most of those patients continue to see us, but I think with us taking over operations, we're gonna need to rebuild that trust a little bit that we are a pediatric dentist and we are providing quality care. So I do think that there will likely be a little lull there as we rebuild that trust and educate people over there.
And just when that ask comes, and it's not coming right now, but when it comes, it's just a one-time ask. It's not like, hey, can you give us $25,000 every year for the next 10 years?
Yeah.
So that will not be the ask.
Yeah. And then just, I know every single organization that's been here there of course is concerns with the nicotine tax and strong features, and we're just very fortunate to be recipients of both of them. And collectively across both funds, we receive a little bit more than $1 million. So as those potentially decline, $1 million is actually that's a very big price tag. So that is something where we are fortunate where our name is actually in the ballot for the nicotine tax, which just provides just a little bit of security. Of course, the tax, fluctuates. So just any advocacy you guys have, if there's any ballots that are coming up, or anything that you feel is related to healthcare or chronic care management or behavioral health, think of us. And then
No, no, you lost that.
All right, and then that patient assistance fund, again, we started at the 125,000, which is super exciting, and we have a diligent team working on it so that that money doesn't go away like that with requests. But what we would love to do is to continue that fund. Our goal ultimately, it's raised currently, I guess, about 25,000 annually to continue to fund that. Truthfully, it just started April 1st, so we'll start collecting money. So we don't know what the ask is really going to look like for that. So currently we're estimating around 25,000, and that will fluctuate depending on the need we actually see.
And we do have safeguards in place for that, right? So that we will not drain more than 25% of that PAF balance in 1 year. And we can make a request to our finance committee to go higher if we need to do that. But I just don't want us to drain this in year one. I want it to be self-sustaining or just have enough funds to kind of keep it going for years to come.
And then participate in sponsored events. We just had Secret of Soul, but then also we have our first annual pickleball tournament happening in August that we're super excited about. We were doing a golf tournament, and then golf tournament's super fun, but also a lot of people are doing them. And so we're kind of like, let's shift it.
Yeah.
And we're big pickleball fans.
Yeah, I'm a big pickleball player.
Yeah.
Well, when I can play. But I wanted to have this done before the August tournament. So I'm hopeful that I'm on the road to recovery, that I can play August 15th in Carter Park. So, but yeah, we did decide to sunset the golf tournament. I looked at the ED calendar for fundraisers this summer, and I saw no fewer than 6 golf tournaments. I think golf's well covered. And there's all going to be golf tournaments, of course, in Denver and Eagle County and all that, right? So there's just one, to my knowledge, benefit fundraiser for Smart Bellies in February for pickleball, which is indoors. And so I know the SCPA, which I'm a member of, has a tournament at Rainbow Park in July, but that's not a fundraiser to my knowledge. But yeah, this will be a fundraiser to benefit elevated community health. We've locked in the dates for the town of Breck. We'll have a tournament director come in for this. So very excited about that. Hopefully we'll get like 300 players. We'll see.
Oh. Yeah. So sign up, registration's open.
Yeah, open April 1st.
And we're taking sponsorship.
Yeah.
So as the CEO, can you actually win the tournament? Or?
Hey!
I have to I don't know, rein it in.
Depends on the donation.
Yeah.
Maybe we could build out if if the CEO beats you, you have to donate it. With your broken foot.
Yeah.
Okay.
Yeah.
And that was it. Do you guys have any questions or anything else you'd like to learn about us or what we do?
Yeah, I, like you, Josh, I just got out some crutches.
Yeah.
I moved here 10 years ago to do the seasonal thing and work at ski resort.
Yeah.
So here's my questions are are your services focused mostly on primary care, or do you offer any type of urgent care, any imaging and stuff like that for our ski resort employees that are here for the winter and break their arm or break their leg? Then the next step of that is how we work with our local ski resorts and all of our seasonal employees to know about the availability of these services.
Yeah, so a couple things. Primarily our focuses are primary care. However, we have been fortunate to work close to the Common Sphere where we have a great relationship with them for radiology. So if any of our patients who are on our elevated care card program, that's 250% or 200% of the FPL level lower. Like an X-ray is like $15, and they can just walk over and get it. So we have a great relationship where those services are at least discounted, but we don't provide them in-house. And then again, we also have relationships if you have our discount where the Ultimate Orthopedics will see you at a discounted rate and multiple PT practice as well. So it's more just that relationship base where we've created discounts there based upon our discount system.
And then from a marketing front, if you have that program, how do you sign up for that? That program, and is that advertised with all the HR departments at the ski resorts, and again, reaching our seasonal workforce?
So that is something that we're trying to work on. We had a board member who works at Copper, and so I've actually presented Copper, I think 5 times now in the last year. So we are trying to build those relationships. And we recently met with Dale to make sure that we could accept their employees' EAP. And then our goal is that when new employees move in, that was just during the late fall, maybe it's early winter, Our goal, I think, would be when all the new employees move into employees housing, that we could sign up. And we've been talking about them having, like, in all the employee housing, use have like magnets with our information there. So not a lot has been solidified yet. There are active conversations about it right now.
And then for long-term residents like myself who goes to urgent care a couple times a year, how do somebody get on that program?
Yeah. So there's just a simple eligibility process. On our website, you can learn about it, and then also when you call our phone, there's a number where you can push to learn more about it. And it's pretty simple. It's where we just collect, like, I think we need like your contact information and proof of income. That's like generally it, and then our team processes it and then tells you what you are. And then it's like an active insurance. And I should note that care covering is not just for those who are uninsured, it's also for those who are underinsured. So if you have like a high deductible, like where you have to pay your $6,000 before you get any visit, you can still also have our care card. So then your visit is still only $20. And so it's more based upon your income. And so you can have kind of like those two insurance. Does that answer your question? Yeah. Okay. Yeah. Any other questions or things that we can help out with?
Just to share with the group, and thank you guys very much for hanging out, and we're gonna roll into Thad's presentation next, but for folks, the folks that don't know, my wife's been at the clinic for over 20 years. She was there before it was an FQHC, and we've watched it develop over the years. She is in school-based healthcare. She has seen multi-generational patients through the office. She's got a great following over there. It's a great program. If you know anyone who doesn't know about it, which is most of the county, Josh and I have talked about this, and I've been ringing that bell for 20 years. When I was at Keystone in Arapahoe Basin, we worked with their HRs to try and make all that happen. It's a great program. Yet again, broken record. They are a great umbrella organization for other like-minded nonprofits in the county where they could help coordinate how those dollars get spent the most effective way. So it's great. Thank you guys for coming.
Thank you.
Yeah.
Can I ask you just one question? I'm looking into possibly hiring a kind of a new position that we've never had before, kind of like think of like a pharma sales rep. Right. So coming from the Northeast, I was in a position like that maybe 15 years ago. So I don't expect to see somebody like what I used to work with 10 or 15 years ago, but I want them to focus on just increasing awareness of the services we provide because, we're just two people, right? So we can't do this every day, all day. We have other things we also focus on, right? So, but I thought about hiring somebody who would do this sort of work. And I would still do presentations like this with Sarah, but other smaller business, I think, presentations, I think could be done by somebody like this. But again, this is a newer kind of environment for me. Been out here for about 5 years. And so what do you all think of somebody like that promoting our services?
I think it would be invaluable.
Yeah.
Like I said, I work in a restaurant full time.
Yeah.
I have coworkers that are uninsured or have insurance but high deductible. You know, I break myself often and I am insured, but my deductible is so high. And so figuring out a way to work, like you said, with seasonal employees, ski resorts, restaurants, like get the word out there because I've been to some county care clinic in the past, but I never utilized it as like, those partnerships. Like the full resource of being able to get an extra. I always ended up at the hospital or urgent care. I think it'd be huge. Just the marketing aspect of that and getting the word out there.
Yeah, that's great.
Well, I expect many EAPs and everything that businesses provide. There's like great people to know about those resources.
I also think it's a great idea. I work across the hall at my behavioral health and I've done a lot of case management in my past and I didn't even know about these things that you're talking about. And there are a lot of resources and like ways to get the word out there if you can't hire somebody, but even just like going to the Building Hope like mental health navigation meetings that FERC is on and everybody is there that can help kind of spread those pieces of information as well. I think it'd be super awesome.
If you all know anybody, just call me, text me, email me. I'll make it happen. Thank you all for your time. I'll make it happen.
Josh, I've got a couple of things. I'll email.
Okay, great, thank you.
Is your email on the,
Let
I
me
actually
explain.
think I know somebody.
Oh,
Is
okay.
your email easy to find?
Yeah.
Or I can get it from Tom.
Anna has it.
Okay.
Yeah.
Thank you.
Cool.
Thank you.
Thanks, guys.
Yes.
Do you want it? I'm gonna get it in. You-
It's 15 minimum. I just get pushed to the next meeting.
Right.
We.
Do it. It's 15 minutes minimum.
Should we grab food to try and bring?
Well, that's what I'm headed
Yeah, we're
towards.
gonna do that.
Grab some
Because I
food
think
and
it's
dive in.
Yeah. So.
Get Robin? Well, she's still talking about.
Oh, you can grab the food now. What's that? You grab the food now.
Oh, okay. Food rescue? Get rid of that food. Really? Really? That just, how? And how do they manipulate small amounts of dollars into large amounts of dollars? They said a couple of times. Right, $20. Gets us $200 worth of food. Through what sort of alchemy does that happen? I mean, that's amazing. But efforts towards, they do leverage donations, they leverage a lot of the chains and distributors use that as write-offs for their before food expires and they gotta throw it away. Why not give it? Here's the value, we'll take a deduction, guy. Okay, thank you. What are you doing to do that?
Food rescues everything from Starbucks to the Keystone Conference Center to those big events. They're getting trays and trays and trays.
Nice.
But then they have then they end up with nowhere to put.
Right.
So that's an opportunity.
Too much food. It's a distribution problem.
Yep.
Okay. Mr. Mayor, if I may?
Please.
Quasi judicial decision making. My favorite of the legal training presentations because it is the most philosophical. The reason it's the most philosophical is because it is driven not at all by statutory rules, right? The Open Meetings Act, big thick set of statutes. The ethics code, both locally and at the state level, a fairly dense set of statutes. Quasi-judicial decision-making, on the other hand, is governed by a single court rule, a rule of civil procedure, and 80 years or so of cases interpreting that single judicial procedural rule, okay? So as you can imagine, it's a little more philosophical, it's a little more case-based, it's a little less, here's the black letter of the law. Suffice to say, though, that in your role as counselors, I can categorize any decision that you make, any action that you take, into one of three categories. You are either and most often you are acting in your legislative capacity, considering and adopting laws, right, to become rules that are applicable either through a regulatory process or through the municipal court. So you're either acting in a legislative capacity, or you're acting in a quasi-judicial capacity. We'll come back to that more later. Or you're acting in what's called a ministerial capacity. You are administering to the business of the town. For instance, you aren't busy adopting a law. You aren't busy making a decision, we'll talk more about in a minute, that applies a certain set of facts to a certain set of legal provision. That's a quasi-judicial decision. In a ministerial decision, you are making decisions about, should we buy a piece of property down at the end of Elm Point Road and build a new public works facility on there, right? You're administering to the business of the town. It's a ministerial act. If a member of the public wanted to challenge that act by way of initiative or referendum, they could not, because it's not a legislative act. You're just doing the business of the town. So as I say, you're either acting in your legislative capacity, quasi-judicial capacity, or ministerial capacity. When you are dealing in let me back up. Let's get to the philosophical part of this discussion first. I would like you to remember back to your middle school civics class, or maybe it was social studies, or maybe you covered it in history, but in some point in middle school, I think most of us, took a pretty deep dive into the nature of our government, right? The separation of powers, the three branches of government, the checks and balances, right? We learned all about
how and why our founding fathers did that. And you know, the essence of it is because they didn't trust kings, right? Because kings got to make the rules, and then they got to administer the rules, and then they got to be the judge to decide whether somebody broke the rules or followed the rules, right? They didn't like kings, and they wanted to spread that power. So they created 3 separate but co-equal branches of government. I'm not even going to get off on the tangent of how that's working out today. So, and you know, the idea, well, they didn't trust kings, but they did trust the idea that power tends to corrupt and absolute power tends to corrupt absolutely, right? So we need to divide the power throughout these 3 branches, and each branch needs to have a check on the other one. So with that in mind, we know, you know, that was the federal system, but that's also the system of every single state in the union. It's also the system of every single county of every single state in the union. I won't speak for Louisiana. I like to pick on them, and I'm not sure that's quite true there. But at any rate, it is also the case in virtually every municipality, right? So we have this separation of powers, checks and balances system at both the federal, the state, the county, and the local level. Why does all this matter? All of this matters because in more recent times, and by recent times, I mean my life, the last 40 or 50 years, there's been the rise of what some refer to in a bad way as the administrative state, but essentially what it is the rise of laws at the federal level, at the state level, at the county level, at the local level, that puts legislative bodies such as the town council or the planning commission, to some extent, they're involved in legislation, that puts legislative bodies in the position of making judicial decisions. That makes courts uncomfortable, right? The whole idea of them being a court is that they are to judge the application of the legislative body's laws against given sets of facts. Why? Because our system doesn't trust a legislative body to do that without being influenced by the political process, right? So this body of law has built up in which basically the judiciary, the judicial branch of government is saying, okay, you lower legislative bodies, if you want to make these judicial or judicial-like quasi-judicial decisions, that's all fine and good and you can do that. But we are going to expect you, and we have built up a body of law that says you're going to act like judges when you do that. You're going to act like judges in the sense that we need you to be making impartial decisions, right? You shouldn't be up there being swayed by your political bias when deciding whether this set of rules applied to this set of facts is copacetic or not. Okay, that's just a simple factual. It's a judicial determination. It's not a political one. So that was the purpose for all of these rules. It is essentially the court saying, that's fine. You want to act like judges, you can act like judges, but you're going to act like judges in terms of the impartiality of your decision making. You're not going to act like legislators. You're not going to act like executives, right? Making decisions and applying the law. So with all of that, and I'm telling you all this, hoping that you will put this in a bit of a context, right? And that you'll look at your job a little bit differently when you're sitting in a quasi-judicial capacity. Now, you did that recently. You did that at the last meeting. Every one of those liquor license applications was a quasi-judicial proceeding. Anytime you have a special use permit or a variance or any of a variety of other site-specific decisions that might come up to the council, either directly or as an appeal from the planning commission, you're acting in a quasi-judicial capacity. So in a nutshell, a quasi-judicial decision is a decision that involves the application of existing legal standards to a particular property or an application to use property in a way that affects the property rights of one individual, but not others, right? This is about this piece of property. It doesn't apply anywhere else. They tend to be, though they are not always, evidenced by a public hearing. So typically it's the legislative body that will hold a public hearing, will act in a quasi-judicial capacity. But so too is staff, like the liquor license clerk, liquor licensing clerk, who has some authority under our code to make administrative decisions. And when she does that, gathers facts, applies the law to her decision whether to renew a license, for instance, she's making a quasi judicial decision, and her decisions would be subject to the same challenge and standards that the councils would when it's acting in this capacity. So, as you probably already guessed, from a legal standpoint, the primary difference between a quasi judicial and a legislative decision is the standard under which that decision will be judged by a court if it's challenged, all right? When you are working in a legislative capacity, you have very broad discretion. If somebody wants to challenge your law just because they don't like the result of that law, what they're going to bring is it's called a substantive, assuming we did everything right procedurally, we had 2 readings of an ordinance and people were given an opportunity to be heard. The challenge that's going to be brought to just your run-of-the-mill legislative enactment is a due process claim, a substantive due process claim. You may have heard those terms before. A substantive due process claim for the average law is simply an argument that your law that you just passed lacks a rational basis. There is just no basis in rationality whatsoever. There's no logical argument you can make to support the fact that this law that you just passed is going to address a particular public issue that is in your purview, right? It's a pretty broad standard. You drive a truck through that, right? Make a logical, rational argument as to why we just passed this law. You don't have to pass a law that covers all of the problems within the field. You can go after little pieces of it, right? So you have very broad discretion, and courts will rarely overturn your decisions on just a typical challenge to your laws being without substantive due process. When you're dealing, and just to put a little bit off on that, when you are legislating in an area that concerns fundamental rights, the First Amendment, for instance, you're regulating speech in some way. Now, instead of simply a rational basis, the court will say, well, you're dealing with a fundamental right, so you've got to show compelling state interest, not just some average problem. It's got to be a big problem. And you've got to show that you have adopted a law that goes after the least restrictive means. So you got a big problem, but you're in the area of a fundamental right, so you created a narrow rule trying to deal with it. Right? So that's when your legislative decisions become more difficult to defend. So let's set all that aside for a minute, or for the rest of this presentation, and go to quasi-judicial decision making. A court will not look at the rationality of your decision. What a court is looking at is what's known as Rule 104A6. Sorry, 106A4. You might have an angry developer stand at the podium. Oh, do what I want. I'm going to bring a 106 case, right? Referring to 106A4, the rule of civil procedure that makes it unlawful for a lower tribunal, that's the council, to make a decision that is either arbitrary and capricious, quote unquote, or ultra vires, meaning outside of the authority of the body to have made. So this kind of claim gets brought. And so what does it mean for a decision to be arbitrary and capricious under that rule? Here's where we turn to a body of case law that tells us that a decision is, well, standards of proof, right? What's the highest? Proof beyond a reasonable doubt. Right? You got to prove that. Somebody got to prove that to put you in jail, or otherwise, you're criminal liable. So there's very high standard. Then there's a substantial evidence standard, right? Less than proof beyond a reasonable doubt, but more than a preponderance. And then we get down to a preponderance standard. 50.00001% of the evidence favors the proposition. It's been proven by a preponderance. Now we come down to the standard that your decision would be held to under an arbitrary and capricious claim. And that is simply whether there was competent evidence in the record in support of your decision. Doesn't have to be proof beyond a reasonable doubt, not substantial evidence, not even a preponderance. Is there competent evidence in the record? So the courts, you say, well, what would that mean? What's competent evidence? What the courts have said is, you have competent evidence in support of your decision if there is enough evidence in the record in support of whatever you decided to make the issue fairly debatable between reasonable people. That's not too high a standard. The court does not have to agree with you.
Wait, say it again.
All right.
Just that last.
The last part. Is there enough evidence in the record? Is there enough evidence in the record to make the question at hand, what was decided, fairly debatable between reasonable people?
Got
it. So what it really means is you can't put ridiculous evidence up in support of a proposition, right? But what it also means is if you have any evidence, you can choose to go with that rather than other evidence which seems weightier, right? The question is, do you have enough to make this question fairly debatable between reasonable people? If it's not a slam dunk in one direction, as you know, to put it globally, you're probably fine, right? The court's going to uphold it. So all of this is the reason that you get a 25 or 30 page staff memo from staff when you're making a quasi judicial decision that lays out, or should be laying out, every single one of the criteria of the code for whatever decisions you're going to make, that then provides you by way of exhibits all of the evidence that staff believes you should see that is pertinent to the issue, as well as all of the evidence that anybody else has provided, either before or during the meeting. It can come up. So on a challenge, after one of these decisions, if there is a case, the first thing that happens is we sit down and we make a record, because the court's review of your decision is going to be limited to the record. Right? The litigants are not going to get to go to district court and argue this decision again. But what they are going to be able to do is look at a verbatim transcript, every single staff member, every single document, every single letter, every single email that was presented to you as a decision-making body, and then decide whether there was competent evidence on the record. Before I lose my time completely, I want to talk with you about probably the most important aspect of procedural fairness in a quasi-judicial decision-making context, and that is the need to avoid ex parte communications. And ex parte communication, ex parte is Latin, the courts still use it for this purpose, but an ex parte communication is a communication made by a person who is interested in the decision to be made to a decision maker outside of the public hearing. Okay. So you're out grocery shopping on Saturday morning. You're right there at the line. You're not doing it yourself. And guess who just pulled in with the basket right behind you? The developer or the owner, right? Who's presented by the developer who's about to be sold. And they want to know what you think about this. You know, what they want to chat you up on this. You should not engage in that conversation. If you cannot, and you should not engage in that conversation because it is an ex parte communication. If you do engage in it, please let me know, because it's not, having that conversation is not in and of itself illegal or unethical or immoral. What makes it wrong is when you don't disclose it and you carry that information into the hearing that the other side didn't have the opportunity to hear. So if you can't avoid it, my advice is tell the person, hey, I really want to hear what you have to say, but you can't say it to me here because we're not in a public hearing. And the more you keep talking to me, the more it increases the chances that I'm going to have to disclose at the public hearing that you chatted me up here. And I'm going to have to tell everyone whatever it is you're about to tell me. Better would be for you to come to the hearing. Next best would be for you to write up your comments and send them to staff. They will be provided to us at the public hearing. If you cannot avoid it, they just will not stop talking to you about it. Then tell Tom about it, tell Katie about it, tell whomever. They will advise me. I will prepare a little script. We will disclose it at the time of the hearing. My understanding is, Counselor, you had a brief conversation with such and so about the subject of this hearing. Is that correct? Yes, that's correct. Can you tell me a little bit about that? Can you tell me a little bit about that? In spite of that conversation, do you feel as though you can impartially and fairly judge this matter based only on the evidence you hear tonight? Yes, I can. Now you're rehabilitated. But ex parte communications are a very good way to ruin a decision if you do not disclose them, because they give a procedural due process claim to the other side. The proceeding has been tainted. It's not fair to them, right? Everyone in an adversarial proceeding gets to make their argument and present their evidence, and it's just not fair when one side doesn't know everything that the other side has said to a decision maker. So there's my 20 minutes in a nutshell. I'm sorry, it went so fast. Most of this is in the memo that's in your packet. I'm happy to take any questions, but I don't know if we have time.
We don't, Thad, but I really like that part of this conversation, and we're probably going to have to revisit it a little bit. In that, is it fair to categorize the last part of your statement as such? If we have a development proposal going forward, or we're out to RFP on a particular property and multiple developers are bringing proposals forward, them talking to individual council members prior to the meeting and none of it being disclosed.
It's not a quasi-judicial decision. If you're talking about granting of a project, that is ministerial. So you can have those discussions outside without disclosing.
Okay.
Just like you could legislation, right? You can hear from your neighbor on what they think the town should do on its garbage can regulations, right? That's just fine. You're making a legislative decision. I'm assuming it's to your trash.
Yep.
But no, you can have those conversations. Now, from a legal perspective, they are not ex parte. Is it a good idea relative to other your other council members and the fact that you're making decisions as a group of 7 is a different question.
Got it. Cool. That will revisit. Okay, good. Thanks.
Do you want to move over there, turn over the room and move to that?
And so I think we can run.
I just had multiple
quickly.
people ask me.
Yeah. Oh, I apologize. I should, yeah.
No,
Yes. Yeah.
I have more questions about it.
Absolutely. And,
Okay.
or we can chat.
Yeah, if we have like a minute.
Absolutely.
Let me know when you're ready, Stacy.
Check 1, 2. I don't like that. Yeah, absolutely. Yeah, thanks. Want me to, for you? I gotta get it in first. Okay, then, yeah. Oh, sure. Yeah. Sure.
Very full work session there.
Yeah, that was
A lot of info too.
Good information. Really appreciate it. That was all.
I agree. I don't know that we'll have that same format, but.
Oh, that was good.
You got the small ones.
Doing up her slide back. This is from the picture. Yes.
Right. Agenda. We don't do that. Yeah.
We're just working on getting the slide deck going for the first item, but in the meantime, we can get rolling. Mr. Mayor, on my computer.
Perfect. Thank you very much, Stacy. Thank you, everyone, for being patient. We had a very informative nonprofit discussion followed up with a very exciting legal advice on quasi-judicial matters. Thank you, Thad. With that, let's call to order the Frisco Town Council meeting for April 8th, 2025. With that, let's have a roll. Here. Here. Here.
Here, Ryan, Gibby, and Goldstein. Here.
Great. Thanks, Stacy. With that, I'll now open it up the floor to public comment. Public comment is reserved for items not already on this meeting's agenda. If you plan to make a comment on an item already appearing on the agenda, please wait until the item is announced and the public comment is requested at that time. State your name and address for the record, be topic specific, and limit comments to 3 minutes or less. No council action is taken on public comments at council meetings. Council takes public comments under advisement, and if a council or staff response is deemed necessary or appropriate, the individual making the comment will receive a formal response from the town at a later date. It is recommended to sign in at the welcome table at each meeting if providing in-person comments, and include contact information for follow-up communication. With that, do we have any public comment in chambers? Any online?
No, Mr. Mayor, not seeing any.
Right. With that, I will close public comment and open up for mayor and council comments.
Yeah. 2 weeks ago, I attended the transit board meeting, and for the last couple of meetings, they're talking about a micro transit pilot program. But what I learned is the Board of County Commissioners doesn't want to move forward currently based on just kind of some of the grant funding question marks that are out there. And they directed the Summit Stage to pursue some new routes or ways to make the Summit Stage more efficient instead of the pilot program currently. And I just thought I'd let you know.
Great, thank you. I've got a little more I can give you later on that.
Okay.
Any other comments? I wanted to thank staff for, there was a celebration of end of season, beginning of end of winter, beginning of summer, some new employees, some old employees leaving. I just wanted to let everyone know that we appreciate everyone's hard work in the transition in the seasons from summer to winter, and also thank the police department for working with a bunch of visitors we had this Saturday at Main Street and 9th and 6th. I always get those two streets messed up. Thank you guys for your work. And I appreciate everyone's efforts. It was an event that was well attended and we had nice weather. With that, any other comments? Great. With that, I'll close mayor and council comments and move on to any staff updates.
No staff updates today, Mayor.
Staff updates. Thank you for that. With that, we'll close some staff updates and move on to any discussion about the consent agenda or motion.
Mr. Mayor, I move to approve the consent agenda.
A second. We have a motion to approve the consent agenda in a second. Please call the question.
Alan,
Yes.
Held,
Yes.
Lincoln,
Yes.
Director Adrian,
Yes.
Ryan,
Yes.
Kibbe, and Goldstein.
Yes.
Great. Thank you, Stacy. With that, the consent agenda passes and we'll move on to our first item of new business tonight, which is agenda item number 1, the McKinstry. It's the first time I said it correctly-ish. Energy performance contract update. And with that, we'll turn it over to staff and Leslie.
Pull it up for you. You make it in there, okay? You think it's popping up, okay?
Well, we're bringing that up. I'll get us started. So good evening, Mayor and Council. So in June of 2023, the town enrolled in Colorado's Energy Performance Contracting Program with the Colorado Energy Office and contracted with McKinstry to conduct an investment grade audit. I do want to note that in the 2020 to 2021 strategic plan, some goals that were set there were the objectives of completing a major energy efficiency upgrades on Town Hall, to complete renewable energy plan for all town facilities, to expand EV charging infrastructure, and then tied to that was also an EV transition plan for the town fleet, as well as some PV retrofits on town facilities. So that is part of the reason that is the main driver of why we engaged in this investment grade audit. And McKinstry has been a great partner to work with so far. And so their team is here. I'll let them introduce themselves and describe the program. And then I'll be available for any questions at the end. We also have Addison online. So he can also answer any questions from the capital projects aspect of things. And then again, I'll help with the questions, and we can also go through the financing in more detail if needed at that time. So with that, I will kick it off to Aaron to start by introducing the team.
Thanks. Evening, everybody. Thank you very much for having us. My name is Aaron Scroach. I'm a program manager with McKinstry. Brought our team with us today. I'll let you all introduce yourselves.
Hello, everybody. Thanks for having us tonight. I'm Ryan Firestone, Senior Account Executive with McKinstry. Happy to be here.
Hi, I'm Taylor Burton. I'm the energy engineer on this project.
Yeah, well, Stephen Rank, a product director based out of Golden. Also excited to share our findings here.
We've got a short presentation tonight, more just kind of an update on where we are with the project. And we'll try to keep it to about 10, 15 minutes and then leave room for some questions and go from there. I'll hand it over to Brian to kick us off.
Yeah, so like I said, I guess first and foremost, nice to meet all of you in person, and thanks for having us. Thanks for welcoming us for this update. So tonight we're going to cover what the purpose of tonight is, our project goals, utility spend, project milestones, our energy conservation measures summary, and next steps. So a question was asked, Leslie had asked us, because I know some of you might not be familiar with who we are. This is a great slide to just tell you who we work with amongst your peers. In fact, there's 36 other municipalities that we've had projects with since 2019. So this is a good slide that just shows who we've been working with and doing very similar programs with. So if you ever wanted to reach out to any of them, we've got great resources. And then over to the right shows just a little bit about who we are. We've been in business since 1960. We've been here in Colorado. Our regional headquarters is in Golden, and we've been here for 18 years. And then a little bit about what we do below there, above and beyond just an energy performance contract. So really, it's important that we show you and you realize that we are all about collaboration. And so we're here to collaborate with you, town council and staff. We're going to update you on where we're at today with our audit findings and ideas. We're going to present those energy conservation measures with cost and savings estimates. And then really we're going to listen to you, right? We want to listen to understand any directives or thoughts or ideas that anyone has tonight. And then this is just a little bit about the energy performance contracting program through the Colorado Energy Office. They've been in business since 1987, 28 years of a lot of success throughout the public sector. So the public sector that we discuss mostly is the MUSH market. So municipalities, universities, schools, and hospitals. And these project goals that you have had from day one, we figured we should probably, go over those once again, right? So we obviously we want to reduce energy use, costs, and greenhouse gas emissions. We want to retrofit to address capital and maintenance needs. We want to increase renewable energy generation, and we want to educate the staff and promote the project. And I think the other big one here is the impact on the community. That's not listed here, but at the end of the day, that's really what we are all here for, right? Is to impact the community with the facilities at hand. And we'll turn this over to Aaron.
Perfect. So just where we are progress wise on the audit, we really kind of started in January of last year. It is a little long process. We worked for the town to get a DOLA grant, which was awarded back in November of 2024. And since then, we've kind of been embarking on what we call our GMAX or our pre-final development. That's when we start to, do competitive bid process with subcontractors to get the best value on the cost and the measures. We're working on our guaranteed level energy savings for the project. And this will eventually culminate in which will be the next major presentation where we're fully finalized on project scope and energy savings. So we're about 85% of the way through the project, but getting pretty close. Hopefully have this finalized within the next couple of weeks. Yep. This is an update on the town's utility spend. This is kind of a key part of the funding that's going to help fund the project. The town of Frisco, for the buildings that are including the investment grade audit, spend about $101,000 on utility bills each year. And so the performance contracting program utilizes guaranteed energy and operational savings from that utility spend as a mechanism to help fund the cost of the measures. And so what we've identified is around $315,000 to $486,000 of energy savings. That's over a 15 to 18 year term. And then down below, you'll see the other funding sources that we've secured so far. So there is the DOLA grant. So we are awarded a $1 million DOLA grant. I'm showing a range here because the project size has gone down a little bit. We're not fully guaranteed the $1 million right now. We need to do one final check-in with DOLA. I think we're probably going to be okay there, but I'm showing a slightly lower range there right now. The town did have a public building electrification grant from the previous project that we're going to tie into this project. Fleet Zero grant, about $12,000 still pending. Town capital, $250,000. And then the Inflation Reduction Act investment tax credit would apply to the solar PV and the EV chargers. And the amount of that measure I'll show you a little bit later is about another $250,000. So on a $2.2 to $2.6 million project, between the grants that we've secured so far, plus the town capital pays for about 80% of that, and the energy savings would pay for the rest over a period of time. So that's kind of the funding mechanisms behind the project.
Yeah,
Pardon
if
my
I could
French.
just, one thing to note there is, so $250,000 input, and you're getting a $2.5 million project. So just keep that in your mind, right? 10-to-1 ratio. It's wonderful. It's a great project.
So please stop me if you have any detailed questions about the energy conservation measures, but currently what's included in the project is interior and exterior lighting at 5 of the facilities, including the tubing hill. We're going to go right after this meeting. We're going to go take some light level readings over there, which should be pretty fun, just to establish a baseline light level for the project there. There's a staff engagement education program where a team of McKinstry professionals will come up here, work with your staff to kind of educate them on ways they can save energy, best practices, things of that nature. We have solar PV systems. Currently, we have 3 solar PV systems included in the project, but we're looking at adding 1 to 3 more in the ECM matrix handout, which I think you guys may have. You'll see those as the yellow boxes, and I'll hand this out here in a little bit. But we're actually looking to add more solar PV into the project, so we should have an answer in that in the next week or so. We have some air sealing and weather stripping. The one photo here is one of the big roll-up doors from the PRA maintenance building. You can kind of see the big gap there. They have to put the rubber treads down where the snowcats come in, and it kind of creates a gap. And so we've got a good way to seal that up to help keep cold air from, getting in the building. Optimized control of heat trace. You've got 3 or 4 buildings in our scope that have heat trace. So we've got some nice neat little controllers that can be controlled with an app to really turn those off when they're not needed. Sometimes often people have them on their house, they'll plug them in, they literally run year round, even during the summer. And so we want to turn those off when they're not needed. At the day lodge, we're looking at a high efficiency heat pump system over there to basically help partially electrify the building. So the heat pump will basically you'll use carbon dioxide as the refrigerant. It's a pretty high tech system to make hot water to heat the in-floor radiant heat at that facility. We've also got some EV chargers going in here at Town Hall, and then some building automations and network thermostats that will just help optimize the control of some of the facilities and give the town better visibility into how they operate. So the next slide, I'll kind of show you some costs and savings of where we're kind of thinking the project is going to come in. Just want to point out that these are full turnkey costs. They include, all services, the audit, design, engineering, permitting, performance bonds, subcontracts, reconstruction services, our construction management. We have a full-time site superintendent on site up here to help manage the project to make sure contractors are adhering to our safety standards and delivering the project with good quality. It also includes commissioning, measurement, verification. Measurement verification is the means in which we demonstrate or guarantee the town that we're achieving our energy savings that are the funding mechanism for the project. And then any warranty management costs. So we've done our competitive bid process for the MEP trades and the solar PV. We are again just looking at adding possibly 1 to 3 more systems here. And we're just about at a guarantee level on the savings calc. Some of that will depend on the final scope measures that get included here. So right now, here's the range of the project we're anticipating coming in here. Again, I say range because we're looking at possibly adding some more scope here. 2.2 to 2.6 million. DOLA grant of $800,000 to $1 million. The electrification grant, TAN Capital, Inflation Reduction Act, $200,000 to $250,000. EV charger grant, utility rebates, and then the annual energy savings generated by this bundle of measure would fund the remaining project costs over a period of time. That all makes sense. And then
Can you guys read that?
that's the real test.
They have it in front of them.
Yeah, we brought some handouts, so it's kind of hard to read, but this matrix just basically just shows you which scope items are going in which building. So the energy conservation measures are down the left-hand side. The buildings are across the top. If you see a blue box with an X in it, that means that scope item applies to that building. The 3 yellow boxes mean that those are the 3 solar PV systems that we're still considering right now. We're really close to finalizing the project. We need a few more weeks here. We should have a final project for you here mid-April. And then project benefits. I know this is quite a bit of words, but I think kind of the big benefits here are, reduce CO2 emissions and making project towards your climate action plan goals. really capitalizing on available grants, rebates, and tax incentives. Again, those all add up to almost $1.75 million. So it's a big chunk of the overall project. It's funded almost 80% of it. And then turnkey design and installation, minimize burden on your staff. So we'll manage and run the whole thing for you. Next. Schedule-wise, so we are hoping to get the contract by this May. Implementation would be 2025. We've got contractors teed up and ready to go. Right now, the apparent low bids are all from the area up here. The mechanical, the solar PV installer, the electrical. So we really are trying to utilize people from the area up here to implement this project. It just worked. And we've also been really pleasantly surprised with the quality of the bidders that we've had discussions with. So they're good enough that we really want to begin in the future on other projects. And then once the project is completed in 2026, then we begin 3 years of measurement and verification for the project. So that's required by the state of Colorado for any performance contracting program, just to demonstrate that the town is realizing the energy savings that we've guaranteed.
I thought I had more questions. I didn't know we didn't quite make it. That's okay.
Because it was like that's right, it was in your last part. Yeah.
So just to cover next steps with all of you. So we, if you all give the approval tonight, we would go back to DOLA. We would finalize the grant agreement. Once we receive the final version back from them, only then can we bring back to you the final contract for McKinstry. And additionally, we could issue an RFP for the financing portion, and that we would finance the guaranteed savings over the life of the project. And so that ranges about 425, maybe a little bit more, up to potentially 486,000. So they'll work on finalizing that amount that can be financed that is identified as those guaranteed energy savings. We would issue that RFP. And then we would bring that back to you upon selection to recommend someone to do the financing for those energy savings. So that does bring us to the two questions that we do have for you. The first one is, does the town council support confirming the town's match and finalizing the grant agreement with DOLA to be partially funded by grant funding, rebates, and tax credits, in addition to the $250,000 net amount that was previously budgeted within the capital fund for this purpose? And then the second question is, does council support issuing a request for proposals for the financing of the energy savings to provide that funding to the project up front?
And I don't think those are like have to make a motion type questions. They're more of a poll.
Yep. Questions for Leslie on the questions?
Just to clarify, what's the match that we have to do for that?
So the net amount, if all of that funding that's outlined in the total sources in the memo, if all of that was received, the town's share of that was $250,000. But we do have to tell DOLA, I mean, our match is, we have to fund the total of the project minus the grant. So we would appropriate the total amount of the project.
Your question slide is in there. It's the last slide. If you go all the way to the end.
Oh.
It's at the very, very end.
Okay. Briefly for the
One back. There you go. Is that what you were looking for? Yeah.
Well, you guys work that out. Fab's going to make some clarifying.
I just had a couple of comments for our new members. You might be wondering, and some of our older members, you might be wondering, why are we talking about debt without having had an election for Tabor or the like, right? Remember, you can't engage in debt without a vote, except in very limited circumstances under the statute, and this is one of them. Years ago, the General Assembly decided, after Tabor was adopted, that if a local government body could make findings that the amount that it was about to save in energy costs exceeds the amount it was about to borrow, that the legislature of Colorado has determined that isn't debt. And it makes sense if you think about it, because it's not the kind of debt that puts the public on the hook for anything. It's the kind of debt that is expected to save money. So just
if you're wondering why it is we're talking about debt, we haven't had an election and we're not even mentioning Tabor. That is the reason. This is a very limited circumstance under the state statute. And the documents will have you making the appropriate findings that based upon their studies, you reasonably believe that you'll save more than you'll spend.
And that is what is being described under financial impact in the memo under Colorado's performance contracting law that references the state statute.
Yes, I just wanted to make.
Thank you.
But you did a great job explaining.
Thank you.
My goodness.
Ask Leslie a question that might answer your question. Please. So there's several different grant sources that are listed there, plus the $250,000 of town money that's already budgeted in the capital plan for this purpose. How many of those grants and to what amounts are still outstanding?
The one grant that's outstanding is the $12,000 EV charging grant. So that's a relatively small portion of that. And then we have not yet received the federal tax credits. Do you know how to apply for them? We have done that previously, and actually McKinstry helped us do that for our solar panels and EV chargers that we already have. So we are familiar with the process, and we will do that as soon as.
But you can't do that until the work is done, correct? Yeah.
Yes.
Thank you.
So 2 questions. One on that tax credit grant. I just saw it. I know it's right here. What was that? It's right here.
So we estimated in
1,000?
the sources, yeah, about 200,000. It
Got
could be
it.
more if we added more solar panels.
Then, so that's kind of the unknown one because it's uncertain.
It's not supposed to be uncertain.
Understood. And then my follow-up is we're looking for an RFP for finance. The way I understood everything was we have all these different funding mechanisms. What we're looking for is a third party to come in and say, oh, you guys have all the funding there. I'm going to front the cash and then I'm going to get all of these grants directed back to me.
Not for the grants. So it would be for the energy savings. So over the life of the project, so we're saying over approximately 18 years, the project from their calculations is currently estimated to save us between $425,000 and $486,000 that we would have otherwise paid in utility bills. It will reduce it by that amount. And so that is how the debt will be paid.
So, money we would otherwise spend on the electricity.
Right. Okay, thank you. Other questions? Anything else? With that, we'll open it up to public comment.
No, it's not.
Oh, it's not a thing, sorry. I just got it down.
Yes.
One question, just a curious question. When you're putting out an RFP for a financing mechanism, are there certain financiers that, I don't know the word, that fund this or finance this type of specific? I was just curious.
Yeah. I mean, they could probably expand on this more, but there certainly are some financiers that specialize in government financing that have done probably several of those projects that they listed on that map earlier. I'll let you guys expand on that.
You're exactly right. There are financiers who specialize in projects just like this. I think Leslie's been in touch with the gentleman who we used on our City of Gunnison performance contracting project, and we have reached out to a couple on this project just to make sure, yes, they'll finance a project this size, within these terms, and we know that to be true. So, but yeah, we would like to do a competitive financing RFP to try to get you guys the best rate possible.
And to the point being made, we have these relationships throughout Colorado for 18 years. So there's several out there that we'll work with Leslie on as at the end of the day, what we're looking for is someone that has the lowest rate and that understands the program. And so we've got plenty out there that we will cover with you.
Cool, thanks.
So with that, to avoid having to go back to tape and counting head nods, is there anyone who doesn't support question number 1? Great. And same question. Is there anyone who doesn't support question number 2? Good.
Now, when that grant agreement actually comes,
Yeah.
that will be a public hearing item. And when the financing comes, that will be a public hearing item.
Thanks. Thanks, Leslie. Thank you guys for coming up. Yep.
Yeah. Actually, I have a place in Keystone, so I'm here all the time.
As a regular business.
Yeah.
Thanks, Stacy. Thanks, Leslie. With that, let's move on to agenda item number 2. Where to go? A resolution 25-19, a resolution authorizing the mayor and the town clerk to execute a contract with Interstate Parking Company of Colorado LLC for parking services in Frisco, Colorado. And with that, we're going to turn it over to staff. Kyle.
Mayor, thank you. Council members, Kyle Ottinger, Community Development Specialist. Tonight, we are discussing the interstate parking contract renewal. In a moment, we'll go through introductions, a little bit about my background with parking in Frisco and who we have representing Interstate here. We're going to go through the history of parking management in Frisco, specifically talking around 2022 and the RFP adoption with Interstate. And then we'll go over current and proposed parking management program. Please stop me at any time for questions. Kyle Ottinger, Community Development Specialist, 2012 through 2016, 911 dispatcher for all municipalities and Summit County government. So that would be incoming parking complaints and dispatching. 2016 to 2018, Community Service Officer, Town of Frisco. 2022, rehired as Deputy Town Clerk, and then laterally promoted over to Comm Dev Specialist, where I supervise short-term rentals as well as our Community Relations Department. If anybody knows Joe Phillips. So parking falls under Community Relations, hence the management of the interstate parking contract. I will let Gareth start with introductions on Interstate.
Cool. So I'm Gareth. I was here from the outset. I know a lot of the counselors, Mayor. And we've really enjoyed, working with the marina. It's been an evolution, as we all know. We all had a lot of thoughts when we started. And it's been really fun to bring everybody together, have a bunch of different ideas, go through all the machinations of all the user groups. And I think we found a nice program that kind of works for everybody. It really, I think the biggest goal has always been to create parking spaces so people can enjoy the marina, basically. And I think we've all, as a team, done that together, and I think it's been a lot of fun. So with us is Jessica and Alicia. Jessica's our VP. She's been here from the outset too, through all the meetings. And Alicia does all our customer care. So if there's an email from the marina or a question from the marina, from a slip holder, paddleboarder, kayaker, whoever, comes through her. So and as you know, we guarantee next day, business day response, and that's Alicia and our team. So that she's the human element to everything we do. So really, I've enjoyed the whole process working with the town and Diane and Logan and everybody else. So it's been fantastic. So love to have a conversation about anything and any questions anybody has or whatnot.
Typically, contract renewals would fall under a consent agenda, but we've had a lot of turnover since the last parking discussion. So for this renewal, we wanted to bring it in front of council. Just one thing to note before we get chatting is that we do have an Exhibit E in this contract, and that includes details and rates that can be adjusted yearly. So just something to remember as we go through this discussion. Parking management. So prior to 2022, Main Street was managed through the police department. We know that prior to 2022, there was a lot of historical staffing challenges, not just in PD, but townwide, which resulted in a lot of issues with managing parking in-house. At the marina prior to 2022, there was no parking management. And as staff can attest, that left just a state of chaos down there when high demand skyrocketed after the big dig projects. Just to remind anybody who wasn't here for those, the big dig just really skyrocketed demand for parking down at the marina, part of the marina master plan, just updating the boat ramp, updating landscaping, putting in the new landing building. All of those things created a beautiful area that people love to enjoy and love to park at. 2022, the town of Frisco issued an RFP in response to that demand. Interstate was the selected contract for that. And this plan includes parking management in the core of town. It started with just the 3-hour enforcement on Main Street, and it has now included the right-of-ways and the alleys from Granite to Galena on both sides of Main Street there. And we have implemented paid parking down at the marina, which is seasonal. We'll go into a few of those details of what that rate structure and what those details are in just a moment. But why do we have a parking management plan? That demand, it creates turnover. When we have turnover, we have a safer environment, we have less emissions, and it helps to support staff down at the marina to not be doing all of this parking management themselves. Any questions on the history and how we got here? Perfect. Overview. What do we have going on Main Street? So we know that we have our 3-hour time limit, and that is from 8 a.m. until 5 p.m. daily, every month except for April and October, I believe it is. We have initiated a new pilot program overnight in the past couple of years, specifically on North 2nd, and I believe that's South 3rd, maybe right there, whichever two I can't read. North 3rd and South 2nd, thank you. These overnight parking pilot programs have really been in response to some of the overnight demand that we're seeing. And we have those. Other than that, 2 a.m. to 6 a.m., unless it's a specified zone like in front of Hotel Frisco, we have overnight enforcement. We have the 3-hour enforcement from 8 a.m. to 5 p.m. Yearly, except for April and October. Any questions on what sort of enforcement is happening on Main Street?
2 months, there's no enforcement, April and October.
For the 3-hour and
3-hour in Main Street.
Correct.
Is there any way to change that to like April and November?
Yeah, certainly.
I mean, I just feel like November's kind of the dud month.
Yeah.
At least from my perspective. Anyway, I'm just curious.
If council had that consensus and wanted to take that to Interstate, that's certainly something that they would willingly, yeah. Interstate's been incredibly responsive anytime we come over with any sort of request like that. I'm thinking, for example, if we, one town activity that we had notified them of, and we had notified them maybe an hour early of like a concert, and they were very responsive. So anything like that, Interstate's been very responsive with us. Any other questions on downtown Main Street enforcement?
I was kind of with Liz on that, it's your April and like May kind of falls in with April, we just don't have that many tourists here, and we want to get as many people as possible on Main Street and getting into shops. And I don't know if we should extend that shoulder season on both sides. You know, why are we enforcing in May?
I fully agree. I've been on Main Street when it's completely empty and we have a parking guy walking up and down to give out tickets and I agree in that we should determine what those dates are. I don't have that right at this moment, but if we could be open to just adjusting the dates a little bit. And I think that's actually extending the period when we're not enforcing on Main Street. That
And you don't have to do it by month too. I mean, we could be more precise than that. Because obviously in November, it includes Thanksgiving time and that's a heavy use time
Right.
as an
Based on tourism
example.
numbers,
Yeah.
dates.
But, we can be more precise about it than just a month.
Yeah, because, it's like Memorial Day is busy, and then it dies down right after that, until July 4th, the third week of June, it really gets the crowds going. So, yeah, if we could look at that, and see if we can cut it down.
I would ask I don't have a giant one way or the other on changing these dates, but I want to ask the motivation of the team. Is it a cost thing for us? Because we'd actually be paying them more for less. Because they would be doing less enforcement, if that was a motivator. I don't think it is. I just wanted to point that out.
I think it's hospitality for people of our town. We shouldn't be issuing tickets when we have a wide open Main Street. If it's not turning over spaces, if the spaces are empty, then I think that's the motive.
I don't know, but I stopped in Idaho Springs to have lunch.
Yeah.
Just during the day, and they had the parking thing. I'm not a genius with the phone, and I just didn't want to deal with it. So I left. So, I'm just kind of wondering, certain things here, is that, I know ours are 3 hours and it's not the same thing as parking, but that's the marina, stuff like that. I just left. So I don't know whether we're losing people or something, probably not so much with the 3 hours on Main Street, but the marina, maybe in the off season, I guess we'll get to the marina. But, in that certain time, are we, losing people? Because they don't want to deal with it. And, the parking lot's not full in May. It's not full in June at the marina, it's not full at the end of September and October. But I think we stop in September or something. So that's just my point on it,
Like you guys, I don't have a giant concern on this. I'm certainly want to hear everyone out. I think my two few further statements would be is piecemealing or one-offing enforcement, I will not support because it builds inconsistency into how that works. So that's a non-starter for me. And then two, I don't know how we got to our current dates right now, but I choose to believe staff had some input on it and there were reasons behind it. And as you guys know, I have full faith in staff. I'm not saying that we can't tweak things, but that's all right. Yeah.
I'm all about the consistency as well. But I know November is the slowest month on Main Street. I mean, Thanksgiving might be
a blip,
but November is the slowest month, and it's typically when a lot of businesses close. I just think October is a more active month on Main Street. So, I'm just saying, if I were to move anything, it would just be,
Yeah.
maybe
No,
the 8th of November, because April's,
I appreciate the discussion on this, and this is why I really wanted to have the discussion. It's not like we're not looking to enforce our times. It's just that I've been out there when it's completely empty and we have somebody giving out tickets, and it's like, that doesn't make any sense. So it seems to me we're already doing October. I think we rely on Kyle and Joe to really determine that, okay, well, October to November 15th is kind of the deadest time. And I don't know, you're not going to make that call now, right? But it's entirely a customer service issue, and it's not necessarily scaring anybody away, but we would surely scare them away if there was nobody on Main Street that got a $70 ticket. And I do appreciate that you guys are really
willing and forthcoming whenever there's an appeal, you're right on top of it, and that's great, and so I do appreciate that. That's the biggest thing. I'm not with that. Yeah, no.
I just feel like not having parking at all is a turnoff as well. Like if they can't, if there's no turnover in parking, then we're also losing people. So it's just,
Yeah, and it's reason to enforce. And we're enforcing also because, the planning commission has called out we should be enforcing for years. And then we finally started to. And that's kind of just for you guys, that's also what led us down this road of getting to this point. I think, as long as we are clear for the public, we are not charging for parking on Main Street, because I get that question a lot. When are we going to start charging on Main Street? Because they think it's a money grab and everything else. And that is not our plan, and that is not part of this plan. It's not part of this contract. And, who knows what the future holds with other councils, but that's my intent there. I think that's it on that issue.
Yeah, so in terms of dates, there's complete flexibility. So if you said like October 15th to November 15th, we do that in BREC. The dates are, they adjust every year actually. So yeah, there's total flexibility there. Maybe that's something Kyle can look at it, let us know.
Yeah, I'd love for Kyle to be able to look at our tourism numbers, see how hotel bookings are and everything like that, and adjust that. But roughly in those obvious mud seasons.
Very weather dependent.
Sure.
That too.
Okay. Anything else on Main Street? That sounded, Mr. Mayor, did you have?
On Main, anywhere, everyone good?
Cool. Just the other thing is the side streets, and we have to eventually figure out the overnight parking as we get more workforce housing going. That's very on our forefront.
And it's worked really well with the 4-month program. It's worked beautifully.
That's good.
That's the beauty of the program is the flexibility, right? So as you guys know, we're local, we're here, we'll make it work, right?
And I think we do note, just to Councilmember Held's point, that with additional workforce housing units going up around town, we may see a deficit in our overnight parking situation. And so we may be expanding this pilot program that we're viewing here. That request for expansion may come to you in the future.
Thanks.
Marina parking overview. Memorial Day to Labor Day. And then we have 2 rates is really how to think about it. You have your non-peak, non-holiday, which is going to be your Monday through Thursday. And then you have your peak holiday, which is your Friday through Sunday. Both of those, you have a free 30 minutes when you register your vehicle. Vehicles must be registered for those 30 free minutes. And times per day are the same, 7 days a week, 10 a.m. to 5 p.m. What's different is the daily maximum and the hourly rate. So Monday to Thursday, $1.25 every half hour, up to a $12 max. And then Friday to Sunday and holidays, $1.25 for the half hour for the first 3 hours, and then $2.50 for every half hour after, with a $15 maximum. Outside of those 2 rates, individuals can also purchase a season pass for $99, and the parking on those season passes are first come, first serve. Broad overview, any questions?
How about just more background for these guys? It was a bit of a rocky road in the beginning, especially with marina boat people and whatnot, and people using the marina. And I think we've actually gotten to a place where everybody's comfortable with what it is. I wouldn't change anything just for that alone.
It's the adoption process getting here, but I feel like it's at a pretty good equilibrium with all the interested parties. Anything from Interstate on the marina rates?
We know the history of the $99 rate for the how that was just, it just worked. Right? And we're just like, okay.
Those season passes do have a cutoff date, but we have been generous, just as a town, if there's been extenuating circumstances on those season passes. No changes to the current agreement, is what we have right here. We will be taking into consideration what council has just mentioned about the dates, for the Main Street enforcement. Same dates for marina paid parking and enforcement. Revenue share remains the same. 50% of paid parking and season pass sales from the marina go to the town, 50% to Interstate. Citation fees are retained by Interstate. That's the same from the first contract. And just discussing a little bit on our strategic plan alignment. Not only does that turnover help to support local businesses and increase our tax revenue, but again, it makes us a destination when people know that they can show up and find a parking spot and have that Saturday or Sunday at the beach that they were really hoping for. It helps our culture, our vibrant culture, implements master plan priorities to manage parking and reduce overcrowding. Parking management's only going to increase with our workforce housing projects coming online. And if you continue to look at CDOT's projections of tourism numbers coming through the tunnel in the next, 5 to 10 years, there's only going to be higher demand for parking in the town of Frisco. So that's why the need is there to continue the parking management program. Staff does recommend continuing the renewal of the contract with Interstate. And with that, we will move into questions.
The gang. Put this to the group is I had a event. We had a graduation party day 1 last year at the marina. Several people got tickets. They were all waived on site. So it was very helpful from Interstate. Thank you. And that's just showing you how easy it's been to work with you. I was at a conference at Beaver Run earlier this year. They usually, in the past years, have closed or not implemented parking in that parking lot, but this year they kept it. I think it was cast. And I pulled my phone out. I let the magic click my zone. It was the wrong zone. He waived it on site. So my point is, it's been very easy to work with in both places. So thank you guys for that. And then I think where we're at is we're not approving or motioning anything. You're going to bring this back with changes. Are we good to go to consent? Is my question, Tom?
You either could do it that way, or you could adopt it with us bringing back the solidified dates as a supplemental.
So is it a 2 reading? Is it a?
No, it's just a single reading.
It's a single reading, so that we'd have to all come back and then approve it with the changes, correct? Unless we just put it on consent.
I can't remember. Did we set out the hours, or we do that with them every year?
Right now we have the dates of.
We do have it scheduled as an exhibit.
Scheduled dates written in there. Yeah, so we would have to.
It'd be best.
It might be best.
To bring it back
Is
on
it gonna be a
consent.
problem from a timing perspective if we put it on the next consent agenda? Okay.
I think we just need clarification of what, is that April 15th, May 15th, and then October 15th and November 15th, or what is it what would you like to see?
Yeah. Totally valid question. Do we want to give direction on dates? Are we going to leave it to staff to come up with those dates? Where do you guys want to land on that?
I think we should leave it to staff and look at tourism numbers and weather on any given season, and if it's a big snow year in November or not. I think we should give that to.
I would say for that it would between the months of May and October, staff discretion when to start and end the program.
We could certainly graph that into the exhibit.
Sure. So back to the final question, is this group good with that then just going on consent instead of coming before us again?
And we would make sure to keep you up to date.
We would get it.
That's good to be.
Yeah.
Sure, if we red line on new language.
I think we should, I think we should include or not include October. I think October is still a busy month with leaves and all that stuff. I'm just throwing it out there. I think October, you know, I don't know. I think it's still a pretty active month.
Well, that's what I'm thinking too. It's, you know, we're saying from April 15th, like May 15th, you know, it could be from April 15th to Labor Day. You know, or, you know, Memorial Day, I mean.
I think as Zach
Month and
was
a
saying,
half,
we let the data, you know, and we let staff,
Yeah.
you know, I mean, like.
I spend a lot of time on Main Street. I'm just talking from.
Oh, I agree. I agree, but that's, you know, that.
Year to year, it does change.
Should work with the
Within
data.
a week or two of each other.
But I like the consistency piece where we don't micromanage it to like death or, you know.
Well, I hate to see that, like, you know, Thanksgiving's a busy time and then it dies down for 3 weeks before Christmas, because that's when everything hits in normally all the time, you know, like, okay, this weekend we're doing it. In December, you know, 2 weeks in December, we're not. So consistency.
We don't need to do that.
Yeah.
Is that what you're saying?
Yeah.
Yeah.
That's what I'm thinking. Once you start it, you're starting it. You don't
There's just
stop
the,
it.
the two off seasons, the two hunting seasons essentially, as long as we can define what those seasons are, and they might be 5 weeks. It might not be 4 weeks, you know, I mean, you know, depending on the data of what, you know, our visitation.
I think we can listen to this recording and make sure that we're hitting as much as what you're saying as possible.
You know, like I said, it could be November and maybe December. Yeah. Let's
You know, looking at sales tax, or tourism, overnight stays, we have all those projections, of how full the hotels are, things like that, if the resorts are open.
We also have the history.
Yeah.
So.
So do we want to have it come back to us or go to consent?
Go to consent.
Yeah. I agree. Consent after Kyle gives it his blessing.
Thank you, Mr. Mayor.
Thanks, everybody.
Thank you.
We are at 3. Let's get them through that.
And then you fill in.
That was great. Thanks, you guys.
Monday. Do you want?
So with that, let's move on to agenda item number 3. Which is going to be first reading of ordinance 25-6, an ordinance amending chapter 180 of the Code of Ordinances of the Town of Frisco concerning zoning by amending sections 180-5.2.9 concerning licensing requirements and limitations for retail marijuana businesses in order to create consistency between the license renewal fees for the town's processing of applications for renewal of retail and medical marijuana facility licenses. And with that, we'll turn it over to the staff, which is going to be Stacy and Pat.
I think I'm gonna start, because again, a little bit of background. Why do we care this much about fees? Tabor, again, Taxpayers' Bill of Rights in 1993 said, thou shalt not increase taxes without a vote. Okay? The response from many municipalities, instead of increasing taxes, they discovered new or made up new and creative ways to impose fees. And when they started to impose those fees, there are those that challenged them in court and said, well, wait a minute. Tabor just said you cannot increase taxes without a vote. And nonetheless, you just increase this fee. Seems to me this fee is just tax, right? Masquerading as a fee. And from those kind of challenges, the courts came up with a body of law to distinguish what is a proper fee and what is an improper fee, essentially a tax masquerading as a fee. And the rule that they came up with was a fee is permissible and not a tax if it is reasonably and rationally related to the service being provided for the fee. In this instance, we have fees for making an application to for a retail marijuana sales license, and we have fees for an application for a medical marijuana sales license, and we have fees for renewals of those licenses. Medical came first. And we knew when we adopted medical, or the council knew and made fees accordingly, that there was going to be a lot more work involved in processing the initial application than there was a renewal application. A renewal application essentially says, has anything changed since your first application?
A little bit more than
A
this.
little, but not a lot, right? It is a far cry from a full-blown initial liquor license application, right? It is essentially asking you to reconfirm. So the idea is, it's probably perfectly appropriate to charge a higher level of fees for an initial application than it is for a renewal, because there's a lot more work involved for the initial than the renewal. So that's how it sat with the medical. When retail came around and the town went to adopting its retail regulations, I believe the proposal was the same. 3,000 for an initial application, 1,500 for a renewal. At the time, though, there was a great deal of concern on the part of council. They said, well, wait a minute. This isn't just about processing the application. This is about our law enforcement efforts in monitoring this license activity. And we think, and it was reasonable to think, that there's going to be a lot more enforcement activity with respect to a retail sales license than there would be for medical. And for that reason, at the time, I believe, the fee was set to be the same for both an initial application and renewal of a retail license, because the thought was, well, what we don't spend in processing, in Stacy's time processing the renewal application, we're sure going to spend in Tom Wickman's time in going and checking on the facility and his officers doing the same. As it turns out, that's not really the case, that there really hasn't been more or significantly more enforcement activity for retail licensees than there has for medical sales licensees. There certainly is not an equal amount of work. So when Stacy discovered it, the inconsistency, right now, you got to pay 3,000 for renewal of the retail fee. When she discovered it, she questioned it. We got to talking about it, and accordingly, we bring this proposal because we believe it's necessary to make our renewal fees consistent with Colorado law. So that's not exactly a nutshell, but that is why we are here proposing to lower a fee that we are currently collecting. She currently collects 3,000 on renewal as well as initial application on a retail license. So there you have it. Happy to take questions.
Thanks, Thad. Questions for Thad?
There are only 2 of those businesses in this town.
Yes, not much of a loss. It's the
Great. No other questions for Thad. We'll open it up for public comments. Any public comments in chambers? Seeing none, any online?
No, Mr. Mayor.
With that, I'll close public comments and come back to council for any further discussion or a motion.
No need for the title. Right?
No need for the title?
No need for the title.
You read it with? Okay, Mr. Mayor, I move that we approve first reading of ordinance 25-06.
Second.
We have a motion and a second to approve ordinance 25-06. Please call the question.
Held,
Yes.
Finken,
Yes.
Repcheck Adrian,
Yes.
Ryan,
Yes.
Kibbe, and Goldstein.
Great. I recuse.
Of the emails.
Oh my goodness, Alan, I apologize.
Yes.
I am so sorry about that. It's my fault.
Thank you, Stacy. Thank you, Thad. That'll pass. Let's move on to agenda item number 4, resolution 25-17, a resolution approving the update financial policies to the town of Frisco. And with that, we'll turn it back over to Leslie.
So in February of 2023, the town adopted its first comprehensive financial policies, which basically combined a bunch of different policies that we had into one document. The reason for doing so at the time was really related to grant compliance. We were applying for quite a few grants at the time, and that is something that's recommended in order to submit those applications. Additionally, just having written policies like this does help promote consistent financial management practices, makes it clear to the staff what the expectations are. And also in applying for bond ratings when we do financing, such as the Granite Park project, that does contribute to better bond ratings. provided by those rating agencies. So within the attached document, there are some changes that are noted. The a new language is noted by a double underline, and the language that is proposed to be removed is indicated by the strike through. To highlight the main proposed changes, one is updating the definition of a capital improvement. It has been at the $5,000 amount for quite some time. Updating it to $25,000 would allow us to not have to include small equipment such as a snow blower within the capital plan, but would still encompass vehicles and those types of items. And as far as, financial reporting on what's affected by what's a capital project versus not. Really, the only place that appears related to the capital improvement fund is within our financial statements in one of the notes related to the financial statements, because we don't actually officially make that record of the transaction within our financials. So, and in additionally, there's some general housekeeping items that are included in there that are just kind of some small changes here and there. Staff, we certainly throughout the year, we review the financial policies. When we see anything that we think maybe needs to be updated, we make note of that throughout the year. And then we generally bring that to you towards the beginning of the year. So with that, staff recommends that the town council approve resolution 25-17 to formally update the financial policies document.
Thanks, Leslie. Any questions for Leslie?
Why did we go 5 times more than the 5,000, right? Why did we go like 10,000 or 15? Who picked the 25?
Well, I think it was really specific that at 25,000, we would still be capturing all the vehicles that we purchase. And so we didn't want to go higher than that. We could go lower.
Because when you mentioned the snow blower, hopefully we're not buying a snow blower for 25,000, but it could be an attachment to.
It might be 5,000. Yeah.
It just keeps it in operating if it's.
Yeah.
Right. Just a different budget.
Yeah. I was just wondering why the 25 is picked.
We just wanted to make sure we weren't excluding vehicles. So that was kind of how we chose that.
Okay.
Any other questions? With that, we'll open it up for public comment. Any public comment in chambers? No. Any online?
No, Mr. Mayor.
Thank you. And with that, we'll close public comment and bring it back to council for further discussion or a motion.
Mr. Mayor, I make a motion, we approve resolution 25-17.
Second.
Great. We have a motion to approve 25-17 in a second. Please call the question.
Pinkett.
Yes.
Scripcheck, Adrian.
Yes.
Ryan.
Yes.
Ibby.
Yes.
Goldstein.
Yes.
Al.
Yes.
And Held.
Yes.
Great. Thanks.
I did just want to add one thing with the transition to Muni Docs. Stacy Nell was wise enough to add on there our financial policies. So if you wanted to go see older versions of the financial policies or know where to access the most updated version, they are available there.
Now I know what I'm going to do before bed tonight.
We'll keep it moving on
You're
to
not very tired.
agenda item number 5, resolution 25-12, a resolution to approve the 10-year capital improvement program for the town of Frisco. With that, we'll turn it over to staff, which is going to be Leslie and Addison.
Actually,
And it looks like it's going to be Tom.
As if you don't hear from me enough in a typical week individually. So this whole process started out in January, where we retreated with the council to start to build a 10-year capital plan. In statute, it's in our policies that we're required to adopt a 5-year capital plan along with our budget. But really for planning purposes, thinking about future debt issuance, or if you're ever going to consider putting a tax question on the ballot, 5 years sometimes isn't enough to think about that type of thing, and really projecting out on priorities around a strategic plan. You want to project out further. At least that's what we're attempting to do. So we had the retreat in January, and we took the council through an exercise of, what's currently in our 5-year capital plan. What are some things that are being contemplated in our strategic plan that want to be in the capital plan and funded in the future? We've gained a lot of experience over the last 2 to 3 years around the capital that already exists in town, so all of our assets, and discovering that there's a lot of deferred maintenance out there. So we talked to the council about dedicating a certain amount of dollars towards that deferred maintenance so that we could catch up and get ahead. There were some other critical capital items that had not had regular maintenance or attention over the years. I'm thinking of the community center as an example, that will need to be recapitalized at some point, just as we're doing with Old Town Hall right now. This building eventually has to have that kind of thing happen to it in order to keep it viable, or consider doing something else for the center of town government. And then, really looking at the overall constraint of the capital plan, which is dollars, and how much can be allocated per year. How do our priorities line up with that constraint, and making decisions around that constraint? So we held a work session with the council in between today and that January retreat, where we brought back kind of some analysis of what we heard in the retreat, put that down into a spreadsheet of what we thought we heard, or what we looked back at the recordings and made sure what we heard, and discussed those things and got some further direction on how to lay out that capital plan. But other things go into it. I mean, we have an unfunded capital list of at least $70 million worth of things. It could be a lot more than that if you look through every plan that we have. We have grant commitments that drive certain expenditures in certain years. We have a comprehensive plan right now that we're about to renew, but it has things in it that it projects. Then we were currently going through the process of finishing up our new comprehensive plan, and it has things in it that want to happen. We have our strategic plan that helps us set priorities. And like I said, what we've learned about our infrastructure in the last couple of years, especially having Chris McGinnis on board and Addison looking specifically at our capital, we've learned a lot and know more that we have to do in order to keep that stuff viable, and so that we don't have to spend the big dollar necessarily replacing it. Also, we've done quite a bit of capital in the last few years. There were some years during COVID that we didn't spend money on capital, so we were doing some catch up. But also the town had ambitions to get some things done. So Slopeside Hall, the Summit Boulevard sidewalk in front of Walmart, the Gap project and its associated landscaping, Old Town Hall. We're doing a fiber project this year. And looking back a little bit, the Marina Big Dig, the lawn, and the landing, all stuff that the town has done within the last 6 or 7 years, and expended a lot of dollars to put those improvements in place for the town. So we're contemplating what the next priorities are. And also within that 10-year period, we are going to retire some debt. So that frees up some resources to either issue new debt or just do pay-as-you-go projects with that money that is no longer going for these debt payments. So to highlight kind of what's in here, it all, to me, and this is the way I look at it, doesn't mean everybody has to look at it this way, but I do. There's one big project that kind of drives a lot of decision making that we're doing within the 10-year capital plan, and that's where and how many years we take to do the Granite Street Complete Streets project that has been a high priority of the council. And the direction we got at the last work session and at the retreat was we'd like to do it while the Exit 203 project is going on so that we're not disrupting the town for several years in a row, that we're concentrating in a certain amount of years. And we want to get it done as fast as possible. So that is driving the decision that you're contemplating while adopting this capital plan, that we're going to issue COPs or certificates of participation, which are a legal debt mechanism of not debt, but it's a borrowing mechanism in order to do that project in 2 years. And so that is programmed in your 10-year capital plan as a draft for 2026 and 2027. So that being a $12 million project obviously drives a lot of other decision making because that's a large amount of money within our capital plan. Now we're obviously going to spread that payment for that over several years through the debt, but it is still a large dollar project, and it's a large project to manage. So it's not only the dollars, it's also the time management of a project like that as we do it. Some other differences from when you saw this plan in work session. We talked, it may not be the sexiest project in the world, but we've talked a lot about bathrooms in the last few months. And the marina bathrooms are in need of being improved and expanded. And so we figured out a way within this plan to also do that project over 2026 and 2027 so we can get it done as quickly as possible and get that amenity better at the marina. Pioneer Park is going to be improved in 2026, currently under design, or will be under design this year. We're going to do another segment of sidewalk to finish between Walmart and Lusher Court, so the section in front of Safeway. That will happen in 2027, so also going on while the Exit 203 project is going on. We will do our work that kind of surrounds, which is considered the local work around Exit 203, landscaping, other gateway amenities that the town wants in that project. We'll do that in 2028. So in the last year that the Exit 203 project is happening. We're going to be installing new lighting at the Tubing Hill and Train Park in 2027. It's pretty much on its last leg, and it's a very inefficient system. So it's also possible that that's going to get wrapped into the McKinstry Energy Services contract that you just heard about. And the Island Grill is an asset that we have that needs some help. It's one that has some deferred maintenance. It also has the ability, we have the ability within a project to perhaps expand. The kitchen is an area that has been that we've been critical of in our plans. We've got that project program for 2030. What we did not include in this plan, there's still a large unfunded list because we don't have the dollars to do things or project to do things right now. But one of the things we did not take care of in this plan that future councils will need to consider is what to do with this building and how to recapitalize that. We will continue to invest in this building in order to keep systems working, to perhaps improve bathrooms, do things with this room that we need to do to keep it technologically up to date, other things. But we did not make a decision to do a big project at this time in the 10-year capital plan. We also did not include any major expenditure around the backyard plan. And my memory of that discussion, and you've had discussions since about kind of dollars that the town may be committed to in the future to implement that plan. We may look at doing a pay-as-you-go program, and we'll have to figure out how to fit that in. We'll definitely be seeking grants and other sources of money to fund portions of that. But you may also look at some type of new or enhanced revenue source, increasing taxes, perhaps, or fees, as the case may be, to either fund that project or other projects so that project could be funded. And we have already started studying that as staff and are going to be bringing some discussions to you in the future about studying that to help you decide whether it's time to do that or whether we wait or never do it, perhaps. The bottom line is that the projects that are in this list on the spreadsheet are funded based on the assumptions of revenue that are in our capital plan. And even though that's a large list of projects and a large dollar amount, we still end each year with a positive fund balance in the capital plan. A lot of work by Addison, Leslie, Diane, Chris to get us here. It really sets out a solid path really for the next few years on what we're going to do and how we're going to go about doing it and get you lined up for the right decision making so that the money is available to do those projects, and Addison, Chris, and whomever else that work on those projects can run with them. So that's what I've got for you.
Questions for Tom? No. No. Great. We're gonna approve the plan. It's not an ordinance, so it's a
Resolution, correct?
resolution. Yep. So with that, we'll open it up to public comment. Anyone in chambers? Anyone online?
No.
With that, I'll close public comment, bring it back to council for any further discussion or a resolution.
I'll just make one comment, Mr. Mayor.
Yeah.
These are complicated. It's a complicated process. Just express gratitude to staff for the hard work put in for this and to make we could get to this point. It's a lot. That's all.
And thank you to Tom for pushing us down this road.
Yeah.
Mr. Mayor, I move to approve resolution 25-12.
Second. We have a motion to approve the 25-12, our 10-year capital improvement program. And a second, please call the question.
Check Adrian,
Yes.
Ryan,
Yes.
Ibby,
Yes.
Goldstein,
Yes.
Allen,
Yes.
Held,
Yes.
Lincoln.
Yes. Thanks, Tom. Thanks, everybody, for all the work on the capital plan. Thank you, Stacy. And with that, we'll move into old business, which is agenda item number 6. Second reading of ordinance 25-05 and ordinance approving a second amended and restated development agreement between the town of Frisco and the Frisco Community Housing Development Authority, the NHPF Foundation, and the NHPF Galena LLC as an amended and restatement of the development agreement between the town of Frisco and the NHP Foundation dated as of May 23rd, 2023, as related to the affordable housing development to be constructed at 602 Galena Street. And with that, we'll turn it over to staff.
Sure. So brief introduction. Obviously, we talked quite a bit about this last meeting and went went through the finer detail points of the development agreement with the town attorney and our contracted attorney. The council gave us some good direction on some changes to make to that. The biggest change being about funding coming from the housing plan for that project to keep it moving on schedule. But there are some things that we should probably detail, and I'm going to turn it over to Thad to discuss what's different between the document in first reading and second reading.
And I'm gonna do about part of it. Do we have John with us on the line? We do. Hi, John.
He's muted at the
Oh.
moment. I'll ask him to unmute.
It's okay.
Just sent him a message.
There it is. The principal change, as council knows, is the filling of the gap. Right? The agreement that was brought to you to the meeting last time contemplated a loan of $3.2 million from the town to the developer. Per the council's direction, that is now $8.1 million. That change alone kind of rippled throughout the documents because we had language here and there essentially about how we were going to try and fill that gap, right? That has now been removed and is no longer necessary. The other three other, I guess, principal changes. We discussed last time the fact that there were a couple of deadlines to be met by NHP with respect to beginning of the demolition of the property and then ultimately residential occupancy of the property. Those are under our intergovernmental agreements, right? We got some grant money from Summit County on that. So there's some revisions to that language, but principally the change in deadline was a movement from September, a early September deadline to an end of December deadline now for them to pull their building permit, essentially, to pay, which is in for review, but all the fees, right? That's what you got to come up with to actually get it issued, is pay all the fees. So that deadline has gone from September to the end of December, 12/31, if I'm not mistaken. The other principal changes are we did negotiate to resolution the right of first offer price. And we also did some negotiations in connection with the loan agreement concerning NHP's completion guarantee, essentially. For some detail on that, I'm going to turn it over to John just briefly on those two financial points. But that is the essence of the changes to the agreement from what you saw last time. That and a complete set of loan documents now. With that, John, can you describe briefly where we ended up on the right of first offer price and on the completion guarantee?
I sure can. Hello, Town Council. Thank you for the opportunity to address you today. We had substantial negotiations with NHP on the right of first refusal and the option to buy them out. So what we're talking about here is at some point in the future, if NHP wanted to sell the project and just walk away, the question would be, to what degree would the town be able to recoup some of the $8 million that it is putting into the project as a forgivable loan? And as a reminder, the $8 million that was authorized by town council in the last meeting is going in as a loan, but it's forgiven ratably over a 30-year period. So it's not really intended to be repaid. It's more a form of assuring compliance with the affordability covenants and other requirements in the development agreement to make sure that the town is getting the benefits of its bargain with respect to the funding of the $8 million. And one of the ways that we have addressed that is we have said that if NHP sells the project, or if they receive an offer where they want to sell, the town has a right of first refusal to be able to buy it on the same terms as another potential buyer on the same offer terms, except that if they would make a profit, and what I mean by that is if the offer price is in excess of their current debt funding on the project, then the town receives half of, or a reduction in the price, if you will, equal to half of what NHP would make in terms of the profit. So in other words, if they were going to sell the project in 8 years for a $2 million profit, the town would have a right of first refusal to be able to buy the project at the offer price minus $1 million. You know, if they were going to make 2 million, the town gets effectively $1 million of it back. And the idea is that we didn't want the town to fund the $8 million and then in the future have NHP be able to sell the project for a windfall, and not have the town recoup any of those funds. So that would be the right of first refusal that that is referencing. There's also a right of first offer that is in the agreement and in the ground lease that says that if the town, excuse me, if NHP would like to sell the project, they have to first offer it to the town, and the same discounted value would apply. So if they're anticipating on selling the project for a $2 million gain in 8 years, the town's ability to buy the project under its right of first offer would be for whatever price that NHP wants to sell minus $1 million by example. So you would recoup some of your money back. And that I apologize. You asked me to address one other item and I'm just drawing a blank on that. If you could remind me.
The right of, the completion guarantee.
Oh, okay. Yeah, I'm sorry. So this is an area that that is part of the completion guarantee is a document that is part of the town loan documents for the funding of the $8 million. And NHP had asked that there only be a guarantee of performance that the building would be built. And we had said that if NHP gets halfway done with the building and they're not able to complete it, and the town has to step in and then complete it, and they have to fund extra amounts that aren't available to it, that NHP has to also write a check. NHP has objected to that, but that's what the current completion guarantee would say. So one of the biggest concerns I would have for the town is exactly that scenario. You get halfway into the project and for whatever reason, something happens to NHP and you're sitting there with a building that is half complete. And what do? They are anticipating to have a payment and performance bond that would help to defer that risk, but those bonds take a long time to collect on and also don't always cover all the cost. And so we wanted to make sure that the town would come out whole. And the way that we were looking at dealing with that would be through this completion guarantee, which the form that's in front of you is both a payment guarantee and a completion guarantee and a performance guarantee. And NHP had asked to not have it be a payment guarantee. The practical difference between the two is without a payment guarantee, you could only take NHP to court and have a court directive for them to build the project, which may just not even be practical if something bad happens to NHP, if they're in bankruptcy or, you know, some other bad thing happens. So we wanted to also have that financial obligation.
Mr. Mayor, just one point of clarification on John's discussion of the right of first refusal. He presents this hypothetical scenario where NHP has decided to sell the project to a third party. Rest assured, it would remain an affordable project in that we would not be in buying it to save it. It would still be subject to the affordability covenant and that purchaser would have to run it as such. So just to clarify, put this in context, we wouldn't be in there trying to save the project.
Right.
We might want to buy it.
Thanks, Tom. Sure. Questions, gang?
Those were good additions to the original conversation.
Thank you.
They are objecting
To the completion guarantee portions.
But if we pass this, Or do they have to accept it as it is?
They don't have to. No.
Well, they can choose to not move forward with the whole thing.
Good. Seems kind of a minor point to dig your heels in that hard on.
It does. Can I ask Lauren how you feel about that, Lauren?
Yeah, for the record, Lauren Avioli, NHP Foundation, just to explain a little bit more on the guarantee. A repayment guarantee on the loan would negatively impact our ability to borrow and even potentially get a lower rate on the bonds that we are trying to get to finance the majority of this project, because S&P will look at the outstanding debt that we have to repay when they look at our credit rating and when we go out to the marketplace to try to issue debt. So that was the reason why we wanted to do not a repayment guarantee, but more a performance guarantee during construction, which means that we could be forced to complete the construction of the project. And that's worth, much more than $8 million potentially. And then post-construction, if we were not complying with the loan requirements, then the town would be able to have recourse to the property and take the property back. So that's what we had proposed. And we understand that the documents have the guarantee as John described it in them currently. And that's what's before you today. So, if you want to vote on that, we understand that that's what's on the dais.
Okay. All right. Thank you, Lauren. I guess I would just say, especially since Mr. Mayor, you weren't here for that meeting. I think that the thing that really drove us down this road was the bottom line is we're getting doors for 150,000 as opposed to where the county's at this point, which is up to 250,000 a door, is what they're paying for. Yes, it is a very much larger amount than when we started talking about all of this, but I would say we all felt that 150 a door was still worth pursuing in order for the ability to come out of the ground this year and and have the fastest turnaround of a project that that we could have. That's I think why I would say how we landed where we did.
And there was things that were going to happen if we didn't go through.
Oh yeah, the unraveling was very in-depth and expensive and time-consuming and whatnot. And so, just to put that out there and clarify, and hopefully the new council members can be sure in the decision that they made, because these are big decisions. And this is some of the biggest decisions we will ever make with the amount of money involved, but it is for workforce housing, and we're talking about coming out of the ground this year. That's all I got to say.
Cool. Any other discussion? Thoughts on tying up all of our housing dollars for the next 5 years? We're about to have that discussion.
I think that's frightening to be real, but I feel like, I don't know, we're spending housing dollars on housing.
For the maximum return on what we could get compared to anything we've done in the past.
It doesn't actually look good, but it will.
What doesn't look good?
Well, just like spending all of our housing dollars on this. But I don't know how else, I just don't know if it's cheaper to get housing done any other way in a certain amount of time. Like we've been doing this for 3 years. I'm probably talking too much, but yeah, it's scary. I'm not gonna lie.
I am just curious about, and I know we've talked a lot about all of this, but a little bit of history. Has there been a formal housing needs assessment done? And just
Several.
does this all
Yes.
align very nicely?
You can't build any housing in Summit County right now that won't fall within any number of different housing assessments. We're never gonna meet the need as stated in all of our evaluations. I think the latest one was at the county level. We then narrowed it down to the 10-mile basin in the town itself. We're not gonna build that many units. We're gonna come close, actually, with some of these projects. So the short answer is yes.
Yeah, the need was called out in our latest assessment at something like 450 units now for what we need for the workforce, which we're talking 50 some odd here and then maybe 50 some odd for the other part of this project. So 100 is what we're talking about. And then, you know, we have other possibilities coming up, but in our future housing discussion, which is going to come this summer at some point, we can also then talk about how we create more housing dollars at that point.
And I did a little research with some help and just got some data like Vista Verde and Breckenridge, 172 units is 90% leased. Both areas in Smith Ranch, which are 135 units, 70 units are 100% leased. 65 units are 75% leased. And then Wintergreen and Keystone, 47 units, they're 100% leased. And I think there's this narrative going around our community that all these places are empty or not leased. And I just wanted to bring that so that it would help.
I appreciate that. Thank you.
Yeah. Sorry, did I interrupt someone?
No.
I was so hurried to find my. Okay.
Yeah.
Anyway, it helped me too, because you hear that stuff around the community, like, oh, these places aren't leased. They're almost completely.
And just out of curiosity, if you know, what is the AMI of those?
I think, from what I understand, there's a variety of AMI, and some are what, they go as low as 30.
30 to 80.
Yeah.
80 to 120.
I don't think there's, I don't think,
Studio.
I don't think either of those projects, there's anything over 120, but I could be wrong.
Yeah.
I don't quite remember.
Maybe I got it. No. But that's a total of 354 units just between Breckenridge, Silverthorne, and Keystone that are, I mean, that just helped me when it comes to spending money and are we doing the right thing?
And the county's housing needs assessment was something like 1,200 units now is what's needed.
Of any particular AMI or just?
Just
every
total, right?
It's terrifying to tie up all of our current budget with this project, but there is still a possibility of some of what we have committed other sources. Is that correct, Tom? There's no guarantees there, but there's a possibility. And we're town staff and working really hard at that. And also this builds opportunities right now for locals to live, which meets our strategic plan.
And I'll just add in, I would suggest for our housing discussion in the summer, you know, some of the things that could be on the table is that we've been banking land for a long time. We could potentially sell some land in order to raise some funds for something else.
Sure.
If we chose. You know, it's not like we're broke, it's that we are spending housing dollars for housing.
Can't breathe.
Until we're until we're broke.
Until we're right. Oh, boy. No, and then we would have plenty of housing built.
And Tom, I know we're pursuing, as Zach alluded, other opportunities for assistance, but as we move forward, right? Because we need the dollars for the capital stack for, I might, wait a minute, no, we might need it for some form of a MIHA application on something. Would there be opportunities to offset our dollars later is what I'm trying to get at. I guess it would make sense just to keep those, but you couldn't apply for a grant for a project that's already on the way.
I don't know of grant programs that are available that way.
And as we know, that's gonna be probably even more limited. I'm just, yeah. Any other further discussion? We'll open it up to public comment then. Any in the room? None in the room? Any online?
No, Mr. Mayor.
Got it. With that, I'll bring it back to council and further discussion or a motion.
Mr. Mayor, I move that we approve the second reading 25-05.
Second.
We have a motion and a second to approve resolution 25-05. Please call the question.
Scripчик, Adrian?
Yes.
Ryan?
Yes.
Hibby?
Yes.
Goldstein?
Yes.
Allen?
Yes.
Held?
Yes.
Higgins?
Yes. All right.
Thank you.
Thanks, everybody, for that.
Appreciate everybody's efforts and all, and I'm very hopeful that we come out of the ground. Thank you, Lauren. And
Thank you.
John and Thad and staff and everyone
Thank you, Joe.
involved.
Great. With that, our next item and last of the evening is an executive session. And with that, I'd entertain a motion.
Mr. Mayor, I move that we enter executive session pursuant to Colorado Revised Statutes CRS Section 24-6-402 (4) (a) concerning the potential sale of by the town of the real property addressed as 275 Granite Avenue and pursuant to CRS Section 24-6-402 (4) (e) to determine positions relative to matters that may be subject to negotiations, to develop strategy for negotiations, and to instruct negotiators concerning the potential sale of 275 Granite Avenue.
We have a motion. Do we have a second?
Second.
We have a motion and a second to enter executive session. Please call the question.
Ryan?
Yes.
Hibby?
Yes.
Goldstein? Yes. Allen?
Yes.
Held?
Yes.
Yes.
Adrian?
Yes.
Yeah, 2-minute break.
Yeah, we have, yep.